My watch says 10:03. It's the 18th of February of 2015. Welcome to our meeting this morning. Thanks to all who are here, and thanks especially to those who have traveled. We have a long meeting today, I think. I know that's exciting news for everyone. I will try to move quickly through items, but also want to always say that if there's comments and thoughts that need to be made, please stop me or slow me down if I don't see your nod. So with that, we'll begin. We're called to order. Will the Secretary take attendance of the Oversight Committee, please?
Okay. Mr. Angelou, I believe Mr. Angelou is ill. Is that correct?
Yes.
Mr. Geiswhite?
Here.
Mr. Guerin? Mr. Holmes? Mr. Holmes apparently has notified the agency that he's unable to attend due to a family matter. Mr. Montgomery?
Here.
Dr. Mulrow?
Here.
Dr. Rice?
Here.
Dr. Rosenfeld?
Here.
Thank you. So the Chair will entertain a motion, if we could, for an excused absence for both Mr. Holmes and Mr. Angelou. Can we have a motion?
So moved.
Is there a second? Thank you. All in favor? Aye. Thank you. Motion carries. We'll adopt the minutes now. Members, the draft minutes are behind tab 1. Are there any questions on it as circulated? If not, can we have a motion to adopt the minutes? Is there a second?
Second.
Thank you. All in favor, say aye. Motion carries. Thank you. First agenda item is public comment, and I believe we have Annette Leslie, who has indicated she wanted to speak, although I do not see her. So we'll proceed at the moment and ask if there's any other requests for public comments. See none. Chair recognizes Mr. Roberts for the Chief Executive Officer's report.
They were very gracious to allow us to use this while the legislature's in session, which makes it very difficult to get the meeting room, so thanks to them. As has been reported previously, tomorrow is the day of our big move. The boxes have already been delivered to our offices. I saw them this morning, and tomorrow we will be packing up. Friday, the movers will be moving the items and setting us up, and then the staff will be uncrating on Monday. We should be able to be reachable on Monday. I think we're always reachable by email because we're a cloud-based service now, but I expect us to be fully operational by Tuesday morning. The items that I traditionally cover, I think, are in the memos behind my tab. I'd like to talk just briefly about what's going on with the legislature and Mr. Abbott's proposal for us. Again, we've reported on this without a whole lot of change from it. On February the 3rd, we testified in front of Senate Finance Committee regarding our proposed budget. Our budget request is not highly controversial and really did not get a whole lot of discussion. Topics that were covered concerned our revenue sharing terms, how they differ, the new ones that you adopted in January to the old ones, the appropriateness of bonds as a funding source for the agency, just general philosophical discussion concerning the product development program and how it relates to other economic development programs in the state, the length of time it takes to get product development returns, and then just a brief discussion there on self-sufficiency as envisioned by Senator Schwartner's Senate Bill 197. On February the 11th, we were called to testify on Senate Bill 197 at the Senate Health and Human Services Committee, and it was really just a reaffirmation of what I'd made as a public statement at Senate Finance, that Planning is always good. The bill asks us to develop a plan with an eye towards self-sufficiency after our sunset year in FY 2021, and the bill was left pending. And I've heard mentioned there may be a committee substitute introduced that addresses some of the ambiguities that have been pointed out, but I don't know if that'll, what the status of that is. Earlier this week, we testified to the House Appropriations Subcommittee on Article 1. The entire hearing on us was less than 12 minutes. It was Chairman Turner was highly complimentary of the agency and you folks for the addressing SB 149 and the audit reports. And I was quite pleased with the way that hearing went, obviously. Other legislation that I am aware of at this point in time, and I'd mentioned this before, that I anticipated a bill concerning an HPV strategic plan would be introduced. It has been. Representative John Zerwas, who is the new chair of the House Higher Education Committee, has introduced House Bill 1282, and it asks us to collaborate actually with the Department of State Health Services on the strategic plan, which is designed to reduce mortality and morbidity related to HPV. In your chairs, I believe, has been placed a document that looks like this. It is the governor's proposed budget. There is a reference to us. The specific references are on page C in the introduction, which is repeated again on page 22. And it states that he would like to provide at least $400 million and up to $540 million of CPRIT's budget be reserved for institutions of higher ed to help fund academic research and the recruitment of nationally recognized cancer researchers to Texas universities. This is part of his major higher education initiative. I have yet to have an opportunity to follow up with the governor's staff in order to parse each one of those words. I've been doing this long enough to know that every word means something, and I do not want to speculate as to what any of those mean, what else might be out there. There will be supplemental materials that I will relay to you as soon as I hear additional information on it. So moving from that, that's a pretty quick pass through on what's going on in the Capitol building. I think you also have had distributed a spreadsheet that looks like this. It has a yellow and a green line on it. Do all of y'all have that in front of you? I want to give you an overview of where we are today with respect to our budget and funds available for grants. And where we would be if you approve all of the proposals before you today. This is kind of a busy chart. The top part of it is primarily the agency administrations. It starts with the $300 million, and we're really just going to discuss bond proceeds because those are the pertinent monies. We were allowed to carry forward a little under $2 million from last fiscal year. So that ups the amount of money available to us to right under $302 million. From that, we have to deduct the agency operating expenses and the requirement to transfer funds to the Department of State Health Services for the Texas Cancer Registry. So that leaves right under $280 million for our 3 grant award programs. As you know, prevention gets 10% of that amount, and that is in the left-hand column. The remainder of it is for research, product development, and academic. Kind of right at the bottom of the first third identifies how many have been approved through today at the November 19th meeting. And then right in the middle of the page are the amounts that will be before you today. So if you were to approve all of the recommendations before you today, combined with what you've already approved, our available funds beginning for the May meeting would be $105.8 million. Our best estimate on what is moving forward to us, and this is a pretty good estimate, though it can change, is roughly $36 million for product development, though that may be a tad high, $70 million for academic research, and $23.2 million for prevention. To cut to the chase on it, it looks like for the first time for you, this configuration of the board, and for me, we will not have sufficient funds to provide for all of the applications that are being recommended to us. I am not asking anything other than, I'm not asking for action here, though I guess it could be taken, of course, but to call to your attention that these issues will have to be addressed by the new Program Integration Committee. We will be getting back with our appropriate review councils to make sure that we can prioritize what we have. And I think that when it comes to the May meeting, we will need to provide you with some kind of precision identification of the different projects to make sure that you concur with what the PIC would propose to you.
Just a quick question or a thought. Rather than phrasing it as if it sounds like bad news, like we have a shortfall of funds to address those things that have been put forward, I would wonder if another way to say that would be that we have great news. For the first time, we'll have the opportunity to fully use all the dollars that CPRIT has at hand. And also the good news is that we'll have to be austere, because with that sort of oversubscription, whatever the right word, we'll have to sort of be budgetarily introspective about how we fulfill that. But I just don't want when you said that it's, we'll have a shortfall or something, it sounds like there's a problem with the system, and I'm just sort of parsing those words back out. Is that a fair way to say it?
That's absolutely fair, and I'm glad you made that point. This is good news. As you know, last year we were fully subscribed. We moved forward $2 million, which I felt was prudent to not spend any closer to the top. But it shows that there is enormous interest in all three of CPRIT's programs. And we already know that there's a lot of good projects that we don't fund due to the rigor of our peer review process. We do have mechanisms in place to prioritize projects. Your priorities project that you approved earlier this year is one mechanism. The Program Integration Committee will use that. It appears to me that all of the requirements that were enacted, SB 149 and elsewhere, are going to operate well.
Wayne, just a question about process. So we'll act on the recommendations today, and then it's possible that we won't have sufficient funds to cover all of those, and so then the PIC goes back and does another scrub. And do you bring a revised set of recommendations back to the OC for our approval, or how will that work if we end up funding in different amounts, or maybe even not funding every one that the OC approves? Just process-wise, how does that happen?
Well, you could ask us to pare down the projects that
Wayne, just for clarity, let me just interrupt. We're going to authorize things as the board today. Those monies are not in any. I mean, that we still have 100 and some odd left, 111 million left after today. So And the next cycle, it could be that they'd have, let's say, if there's 111 million left, let's say they had 120 million things that came through the process. The PIC would have to then whittle that down to whatever's left, and then would only
Okay.
present to us that which we have funding for.
All right,
So
I
think that's how it
misunderstood.
would work.
All right, I thought that the funding would fall short of what our obligations would be when you
No.
consider first, second, third tranches and things like that.
No, sir, that
Okay.
won't occur.
Okay, all right, thanks.
Just for clarity, I'd asked this question yesterday, I apologize, but there's only, what will arrive on our tables for review that comes from the PIC for the rest of this fiscal year is things that happen today, and after today, we'll have 111 million left. And then after today, there's only one other meeting in May when things will come to us. The August meeting actually is not in a position to have received things that will cycle through for funding for us. So the answer also is that we have the funds for today, and again, we'll only have one more cycle that comes to us that will be one more time when the PIC comes to us with a bunch of grants this year, and that'll happen in May, if that makes sense. Please.
If we have to prioritize for the next cycle, can you remind me of what process we have in place to make choices of priorities across programs?
You do. I mean, you do. Certainly, within the two activities in the research, I believe you could with prevention as well. But the way I envision it working is that we will go back as staff to our individual review councils and make them aware so that they're very careful in how they rank their projects that come forward to the Program Integration Committee. The Program Integration Committee will take into account not only the amount of money that we think is available, but also your priorities that you've already established, which we view as solid guidance to us on establishing our priorities. And then I think we could go about it any one of a couple of different ways, mix and matching or just taking the highest scores. But I believe that it's the responsibility of the PIC to bring forward to you recommendations that fall within the amount of monies that are available without passing the buck to you. Not making those hard choices. But I do think that we will have to explain by our rules why certain projects that were recommended to us by the review councils are not being recommended by the Program Integration Committee. We'll have to document what that is. We would bring that documentation to you, and you, as an oversight committee, now have the authority to approve each project, and you do, each project individually. So if there is a disagreement, you can alter the PIC's priorities or concur with them and make those decisions at that time. Did that answer your question? I sense I didn't.
Set the program
Yeah, I mean,
to guide the PIC.
exactly. The program priorities was an effort to help enliven a prioritization for the PIC. I'm just commenting and reflecting. And Wayne's vision is that the PIC would do that work, and he would bring something to us that totaled up to $111 million in May, and we might vote up or down. We also might decide we want to do another process, which is to say, do the usual thing, let $130 million come to us, and we'll look at and we'll vote them up or down. And then, our rules and statute, I think, require us, if we don't accept what PIC brings to us, to explain why, and we might explain why, because we don't have enough money. I mean, not because the monies we have are limited, and we have to at some point cut something that would otherwise be an interesting thing to fund. So again, maybe part of this discussion is to let, Wayne and staff come up with a plan and then come to us with that plan maybe intervally or when we come to the next meeting, and then accept that plan and then go forward with that in May. We could also discuss more today if you'd rather have it differently, but I think, again, Wayne's vision is to let the PIC do that work and then come to us with a number. I mean, that would be an up or down, just as we do now with we accept slates and move forward. Doesn't have to be that way, but that's just sort of, I think, what you've envisioned is to be workable.
Yes, I like that. I'm just trying to think in advance and get my head around what potential challenges that we might face. And is it correct that, for example, there may be grants coming through in the research program that are rated higher than applications that are coming through in the product development program, but that might not get funded? Is that one potential scenario?
Yes, but I would caution you to remember that even within the research program, different panels have their own relative, what does a 7 mean versus a 6? And hence we asked the review council to prioritize all of the projects coming up from the individual peer review panels. And each of those panels have worked together for a long time, and they have their own way to interact and how they interpret those scores. And it's not necessarily fair, particularly in the case of product development. It may be that a product development views the cutoff level as being a 4, but the research does it at a 3, that means that the 4 in product development is less rigorous review. It just happens to be what the number that they settle on. Did I articulate that correctly, Kristen?
One scoring system isn't the same as the other.
It's the same.
Yeah.
To be clear, the scoring systems, it's all 1 through 9, but you have different groups that are assigning what they mean to the numbers. And so it is hard to make a comparison between two groups of people.
And again, I don't know, the other thing I've wondered as we've had some side discussions or evolving discussions is that, you might say, do we want to limit, or would someone want to limit the size of a product development grant? So, because those are much bigger, obviously, we have fewer, much bigger ones, and you might also balance the portfolio challenges by saying, that let's say the review committees all told, recommended 130 million, but some of the product developments and quite frankly some of the other scientific research might be pared down from an 18 million award to a 12 million award, and all of a sudden you do that to two grants, and then all of a sudden you're in the right spot. So you could still accept what the review committee would do, but just pare down the dollar figure. Again, I'm just restating the obvious, but those kinds of strategies might be ways for us to fully respond to what the review committees suggest, have that come through to the PIC, and then surface to us. And that would be something we hadn't done before. But again, those are just other alternatives that could be out there. And again, maybe those are the things that you're going to sort of consider as maybe one way for the PIC to take control of the whole thing, and then just bring us the last the final result. Does that make any sense?
Yes,
Oh,
it does for me.
So is there any other question or comment on this? I mean, this is a sort of obviously an important issue, but I think it's one that I think that we're going to rely on the PIC to work through and then bring us their solution and, an offering on in May when we'll have to actually accept it and vote on it or come up with an alternative during the meeting, right? Okay, proceed, Wayne,
I
sorry.
am through with my report.
Any other comments or questions in for Mr. Roberts?
Wayne, one quick question on the governor's suggestion that the research would get $400 to $500 million. Is that $400 to $500 million over 2 years, over 10 years?
It's a biennial figure. I mean, it's 2 years. It's a 2-year period. It's not, it's not the state budget, when they're talking in these terms, they're talking about it in a 2-year amount. We have 300 million, so when they're talking about 400 million, it's from the total 600 for the 2-year period.
Okay.
I assume the up to 540 was just taking the 10% of prevention off the top. I mean, not taking into consideration that there are operating budget issues, but
That's how I interpret it. And I will get more information, but I don't want to speak out of turn.
I was just trying to run the numbers, and if I've done the math right, and you have $300 million a year to spend, and about $200 million is dedicated to research, and then there's $30 million dedicated to prevention, and then there's overhead of some millions of dollars. That would leave about $50 million for research a year, which maybe would fund 1 or 2 projects.
My back of the envelope calculation has it that they're kind of shooting for an 80-20 mix between academic research and product development research. And over the life of the agency to this point in time, that is roughly what the split has been.
Thank you.
Other questions, comments? Thank you, Mr. Roberts. I'm going to just move backwards in the agenda for one moment to the public comment section again, because our public comment request, Annette Leslie, is here. So can we, if she's ready, and we can also do this later if you'd rather, but be happy to bring you forth now. So let us do that portion of the meeting then now. And
Thank you so much. Yeah.
well,
And I was planning on working in tandem with Dr. Tomlinson, and so she said she'll go later. But it's you know, it's for the childhood cancer, but you know, for what we do, and so. And I approached you before. Thank you for taking a few minutes for me to visit.
I know we know you, but say your name and then proceed.
Annette Leslie, and
Thank
I
you.
serve on the Childhood Cancer Advisory Council since 2010 for CPRIT's, Childhood Cancer Advisory Council. And I've met all y'all before. So anyhow, thank you for giving me a few minutes. I know this is going to be a long meeting. So, and just again, I just do love the slightly overconfident swagger of being a Texan. And with CPRIT as a recognized leader in cancer research, I spend quite a bit of time in Washington, D.C., kind of champion alongside Congressman Michael McCall, who this is his jurisdiction here in Austin. And I've worked with him on childhood cancer research in D.C. in a numerous ways. It's been a humble privilege to work with him. And before cancer invaded Carson, I was a first grade teacher. So analogies are very much part of the way that I communicate, so bear with me. If there was someone in America walking around randomly claiming the lives of 2,500 children every single year, somebody in America would take that person out. That's what America does. We protect our children. And maybe it would be a Texan, but I know that somebody would take that person out. And that is cancer that claims the lives of 2,500 children every single year. Cancer, as you know, is the #1 disease killer of American children. American Cancer Society, that's one of their statistics. Childhood cancer spares no ethnic group, no socioeconomic class, and no geographic region. American Cancer Society statistic. The last 20 years, the FDA has approved only 2 pediatric drugs, primarily for children. And this is one that Congressman McCall gets under his skin, that there's been only 2 drugs for children in the last 20 years. And the statistics that has some celebrating is the survival rate for children in cancer is up to 75%. But that statistic is based on surviving is 5 years. So let's say a child is diagnosed at 4 and dies at 9. That's not really surviving. Our committee is so grateful that CPRIT has heeded our pleas and has moved to action and has voted to make childhood cancer a priority. Thank you so much. After CPRIT has carefully invested the billions they're charged with in cancer research and the books are closed, CPRIT will have a legacy. And I believe that CPRIT does have the chance to be the change for childhood cancer patients, not only in Texas, but across our whole country, our whole planet. Dietrich Bonhoeffer said, the test of the morality of a society is what it does for our children. So thank you so much for heeding the pleas of our committee. It means so much, and it helps us in many ways. And you'll hear more from Gail in a little bit. So thank you.
Thank you.
I appreciate it. Thank you.
Moving on, we're going to go on to item 6 in the agenda, and we'll recognize Mr. Reisman for Chief Compliance Officer's report.
Good morning, Chair Rice, and good morning, members. My name is David Reisman. I'm the Chief Compliance Officer for CPRIT. As part of my duties, as you know, is to monitor the timely submission and status of required grant recipient reports and notify the Oversight Committee of a grant recipient's failure to meaningfully comply with the reporting deadlines. As a summary, as of February 6th, the date report received from SRA, our contract who's responsible for the grants monitoring system. The date this report was run, 4 grant projects, either act over and close out at 4 different entities, had not filed their quarterly financial status reports by the deadline. As you remember, at the last Oversight Committee meeting on November 19th, I reported that 43 grant projects had not filed their required FSRs by the deadline, and that number had decreased from the prior meetings, as you remember. Additionally, with regard to required progress reports, 6 grant projects, either active or enclosed, that had not filed their required progress reports by the deadline, as that they were required. And these numbers, as you remember, have come down a lot, and that's because our grant specialists and grant accountants have continued reviewing and processing the incoming reports and reaching out to those grantees to resolve these filing issues that they've had. And so as a result, there has been some significant progress to reduce these delinquencies. Let's see, and also when talking about this reports, I do want to note that as reported to the Oversight Committee meeting at the last meeting, SRA, who runs the software grants monitoring system, is still trying to finish its reconciliation project. A lot of that, the grants monitoring system is a big software system, and there's some I guess programming issues involved with that, as well as locating some reports. If you can imagine, the software system is a huge database with slots for each of these reports. And I think as this reconciliation project moved along and the programming was put in, a lot of these slots weren't filled in, looking like there was a lot of missing reports. Staff has been able to identify where a lot of those reports were. I think as it picks it up, some had been dated wrong or miscoded and weren't filling in the slots, and a lot of those had been identified. That project is just still ongoing. It's hasn't been resolved as quickly as we estimated earlier, but that's something that I think it's still continuing to be worked on, but something the Oversight Committee needs to be aware of and keep on top of for the future, because on the trends, we can see where the data is and the reports are missing, but we still don't have a really accurate picture. And so when that reconciliation is done, it may show up with some more missing reports. Hopefully not many, but I think the Oversight Committee just needs to stay on top of that and see where that's going. And also, in working with Chair Rice over the past few months, and I report on these numbers, but it is difficult to see, you get an overall picture, a clean overall picture of where we were. And so when I last met with Chair Rice, I showed him this document that I left on your desks just prior to the start of the meeting, and it's a spreadsheet. And this is essentially what I was trying to do, is give just a clean picture, kind of a pedigree of sorts, of the status of each grant, active or in closeout, and what the status is. And what this is, just the totals are at top, but it covers each of these required reports, the quarterly report, annual report, final progress report, and so on across the line. And you can look down at each of these grants, at each of the for each of the grantees, and see the status. If it's green and 0, they're up to date. If their block is shaded red and then there's a number in there, they're delinquent on that report, and that shows the number of days late that report is. And so you can kind of just quickly go down and get a quick visual of where the status of each of these reports is, who's delinquent, and by how much. And these delinquencies could be technical issues. They could be they're just late. They need to get it in, and we're reaching out to them. Otherwise, there might be a legal issue involved with some contract issues type of thing. But as you can see, there's not too many. There's 557 grants active or in closeout, and if you add up all those required reports, it comes to about 5,013, and the delinquencies total 25, which is about 0.5%. And so it gives you kind of a quick visual of where we are in the grant reporting process.
Mr. Reisman, is this essentially a document that we can use, kind of like our pedigree on the process of when grants are going through the process of getting approved? That's the pedigree, we call it.
Yes.
And this is kind of the other side of the coin. This is what happens in the monitoring system that gives us a visualization for the post-award kind of period and the reporting that goes on there. Is that?
Yes, exactly. So I was just trying to come up with something like a pedigree, that it's a quick visual that you can easily identify in the post-award period who's up to date and who's not. And then we can drill down to see, why. There might be different explanations, but it gives you that overall picture where we stand, rather than just reporting on numbers. You can kind of see. And that's what I was shooting for here.
Thank you.
And if there's any recommendations on how to improve it, please let me know. Just this is a document that sifts through the giant database of numbers out there that I just came up with a lot of programs and formulas to sift through that and give us this condensed version. So I'm just trying to, hopefully that's the visual, but I'll take any recommendations I think that you have.
Just one question. There's some that are terribly delinquent. Is that some extraneous cause? In other words, It's not because the staff is working hard or they're not trying or something else, but when you have the very last one, Visual A is 533 days, 229 days, that sounds like to me that something else is going on, that it's not.
That's, and that's more of a contractual issue. I think they closed out and monies were exchanged and the project is done. And those reports that are still in our system as due, I think many of those had been caught up to date. I think Christian might be able to explain a little bit further on where we are legally with that, but that's the behind that. There's one up there further with on page 4 that has a lot of delinquencies, and that's a company that was recently sold. And so we've been working with them. We actually sent three of our team out to meet with them last week to get their records up to speed, to actually sit with them, put everything in the system, and now it's a point of them submitting those documents to there. So we're able to identify which is the problem areas, go out and reach out and resolve that. So.
If I can address the two that David was talking about. First, Kalon. This was a company that was awarded before the moratorium, but the contract didn't get executed until after the moratorium. And the effective, as with all of our contracts in the moratorium, we have an effective date in the contract so that we can keep it within the fiscal year that it was awarded. So on the day that the contract was executed, all of those reports that should have been filed from the very beginning of the effective date then suddenly showed up as being delinquent. And as David said, we have worked with them. The other challenge was they were acquired by a new company, so it's all different staff. So the grant specialist, a grant accountant, and the grant specialist manager went out to Kalon and met with their new staff, worked with them on all of their reports to make sure that once they were filing them, they would be, in the format that we could approve quickly. So hopefully that will be taken care of. With Visualaise was the company that ended up, they had been paying to CPRIT through revenue sharing, and they ended up accelerating all of their required revenue sharing payments to us to terminate the contract. We hadn't actually expended all of the money or the time on the contract, so it's still in our system as showing additional reports. Additionally, we have asked the company for some final reports, and that is what we are waiting on. If we can't get them and we're working with them, they also were acquired by somebody else and say, we're kind of out of luck. They may be an example of one of those that move to our ineligible to receive grant funds from CPRIT.
Yes, sir.
David, what's the category hub and Texas suppliers? That seems to be a big deficiency. What does that mean?
Those are the hubs. A hub is historically underutilized businesses, and it's a requirement that we track track how much money is going to these historically underutilized business, and that's done through this report. And the hub, one of the issues going on with, and some of these might just be late, but one of the issues going on with this reconciliation is I know that it's SRA, when our grantees are trying to file these reports, they're saying, don't file this report, we're doing this reconciliation right now. So they're actually having to hold on to their report a little bit longer, so that's why the delinquencies, I think, are a little bit higher in that column than the others. Thank you.
The hub business, it has, like UT Dallas is one of the ones that shows hub business column delinquency. Would that be UT Dallas has a subcontractor or a partner, or how is UT Dallas rated as a hub business, a hub recipient?
Go ahead.
It's not that it's rated as a hub business, it's that as part of the reporting for, part of our rules and our statute require the grant recipients to make reasonable efforts to use hub businesses if they're going to do any subcontracting. And so we track that through annual reports from the grantees. So even if they, because like David was explaining, we have to have a slot in our CGMS system and our grant management system that has to be filled with a report. So even if that report says we didn't spend any money with hub subcontractors, we need to get something from them that tells us whether money's been spent with hub contractors. The second part of that is the Texas suppliers, and that also we require by statute that at least 50% of the money that's being spent has to be spent in Texas. Frequently, it's much higher, but they have to report to us if they're spending money outside of the state. And so that's the other part of the report.
Thanks.
Other questions or thoughts?
And I'll just...
I'm sorry.
Go ahead.
No, please.
I'll move on into grantee desk reviews and site visits. As we reported last time, our grant specialists have been undertaking desk reviews, and that's ramped up. We've done quite a few more now, of 16 desk reviews. We've got more, currently pending. On top of that, we've got 10 site visits planned, where actually, our CPRIT employees will be going out to these site visits and looking through documents and records as a preventative measure to work with the grantees to see if they're complying with all our rules and regulations, answer questions, and make sure that everything going through these records, they have all the policies and procedures in place, and they have the budget and payroll records and timekeeping all in accordance with what we're looking for, and hopefully that will resolve future delinquencies there. And just in closing, I just want to remind the members that on April 30th, your personal financial statements are due. Everyone's favorite time of the year. And if you haven't already, you'll be getting a notice from the Ethics Commission and reminding you of that date. And you file, by statute, you file your personal financial statement with the Ethics Commission. And you also, by CPRIT rule, you file a copy with CPRIT. And you can get a copy of what you filed last year from us or the Ethics Commission, and sometimes that helps you fill out your personal financial statements. I know there's a software that many of you used last time, and if you log back into that software, it automatically updates with the new form and your information, so you can make any changes if there are any, and then submit it. That's often the easiest way. But also you can ask CPRIT staff, and we can send you your last year's and make it a little bit easier for you. And remember, it's and if you're getting close to that April 30th deadline, you can ask for a 60-day extension in writing to the Ethics Commission. But if you miss that, if you miss the deadline, it's a $500 penalty. So I just want to emphasize the importance of that and give you early notice. And I'm sure, like last time, everyone will submit it on time.
Thank you.
So if there's no other questions, I'm done. Thank you.
Just one, I understand the job is not quite as exciting as you'd like, so you're taking another one. Just thanks for all your hard work, and good luck, and good luck, and good luck.
Thank you. I've enjoyed working with all of you. Hopefully I'm as successful there as I've been here. Thank you.
Thank you. I think others would echo
Mr.
those
Chair,
comments.
I'd like
Yes.
to make a comment too. David will be coming up a couple of more times, but we at the staff level really appreciate the work that David has done in getting this program to the point we are today. His position is not going to be an easy one to fill, but thank you. He's going to be used in his new position. I'll just leave
Yes,
it.
congratulations on
But
this
thank-
opportunity.
but Thank you, David.
Thank you, sir.
Thank you. We'll move on to item 7 in the agenda, Chief Operating Officer Report. Chair recognizes Ms. McConnell, and it's tab 4 under our book here.
Good morning, members. Heidi McConnell, Chief Operating Officer. I'll summarize quickly the financial overview. So CPRIT expended approximately $1 million in our administrative operations in the first quarter of this fiscal year. And we received $1,000 in revenue sharing payments during that period as well. And again, that money is deposited into the General Revenue Fund, and so it is available for any appropriation. We do track it, as you're aware, on our dashboard. To date, we've received about $2.2 million, but that is one of the items that we've requested through the legislature, that they do put the sinking fund and make it an account within the state treasury. We also reported on our first quarter FY15 performance measures. There are 6 measures that we're required to report. On a quarterly basis, we only report on 2. One is a prevention measure. The other one is related to product development. You have those numbers there, and if you have any questions, I'm happy to answer them. One other item, the debt issuance history, there was no change to what we reported at the November 19th meeting, and our total debt issued to date remains at $606.4 million. One other thing I wanted to follow up on is that we're working on finalizing the contract with the Austin Renaissance Hotel for the 2015 conference, and that was a contract that you approved at the November 19th meeting. Kristen Doyle sent a notice to you yesterday to verify that no one on the Oversight Committee has a financial interest in the Renaissance Hotel, in accordance with Governor Abbott's letter that directs agencies to implement the provisions of SB 353 filed by Senator Nelson. I believe we received responses by email back from everyone except Mr. Geistwhite.
And actually, Mr. Geiswhite has now filed his also.
Okay, so we have no financial interest, so from any member of the Oversight Committee, so then we can move forward with the contract, and so we will do so. Thank you. Are there any questions?
Thank you for your quick response to that email yesterday.
Questions, comments? Thank you. I'm sorry.
Heidi, can you explain a little bit more the performance measure report and why there are so many things that are not applicable? And can you explain the column about percent of mandate attained?
Sure, certainly. So the information that's here is based on what we have to report to the Legislative Budget Board. And so that, what in particular, I think what you're referencing is the amount we reported for the prevention measure related to number of people served by our institute-funded prevention and control activities. That 178,000 amount is what we actually reported. The system that we report in, called ABEST, it actually calculates that because the total annual performance is 400,000 on a quarterly basis, the agency would report approximately a quarter of that, so 100,000. So that's why the percent of mandate, they automatically calculate it. So at 178,000, we're at 141.79% of the 100,000 that we would be, that they estimate that we would be reporting. Related to the other four measures, the NA, we don't report those bottom four measures on a quarterly basis. They are annual. They are only reported annually to the LBB. And so it's just a way to kind of visualize it on this, because we can't, we just don't collect that and report it in a quarterly manner.
Do we have any reason to be concerned that at the end of the year that we will not achieve the targeted performance levels for all of these?
Not at this point. And if we don't, we have this option, which you'll see at the bottom, the variance explanations, and we would provide that information here to you, and that's what we also have to provide to the Legislative Budget Board. But, I mean, you also have to remember these numbers were actually set now about in 2013. And even before that, we had to develop some numbers to propose, and then the Legislative Budget Board determined what we were required to submit. So it is kind of an extended process.
Any other questions, thoughts? Thank you. Thank you, Ms. McConnell. So we'll move on now to item 8 in the agenda, and the chair recognizes Dr. Garcia to present the communications report. We're in tab 5.
Good morning. Under tab 5, we have a brief communications report. You have a summary of the coverage CPRIT has received over the last quarter. You'll see in some of the selected articles that we put in there that we had a few articles on our priorities project, and those resulted from interviews that we coordinated, and so we are very pleased to see some interest in our priorities project and our program priorities. There was also a nice op-ed from Dr. Kripke in the Houston Chronicle. And there's a couple of other articles that are in the works that should come out pretty soon. One is with the Texas Tribune and the other in Texas Medicine. And we put both of those publications in contact with some of our grantees. They've interviewed staff, so we're looking forward to those articles coming out pretty soon. In addition, in terms of news, this morning the American Cancer Society had a press conference on a public opinion poll that they conducted. And I believe you have that in your material, and I believe Wayne had sent it out earlier as well. But We were very pleased to see the American Cancer Society present this in a press conference today, and very pleased with the results. There were, in terms of the results, 88% favorable impression of CPRIT, and then another 70% who felt it was more important to continue CPRIT's research and prevention work than to save taxpayer dollars. So some very interesting results, and we're very proud of that and really appreciate the sentiment expressed and the vote of confidence from the public. So we'll monitor and see if the media picks up on that story. There was some press there this morning, so we'll see where that goes. Wayne, do you want to add?
Yeah, I would add that we were unaware that this poll was even being undertaken until it was presented to us a couple of days before the, was it Senate Finance or was it Senate Health and Human? Nonetheless, we found out about it before we started to testify, and it was very heartening results, but we're very much appreciate the American Cancer Society and they're doing this. It's something I think we can build on.
So just to continue with a few other items in the communications efforts, I'm happy that Jeff Hillary has restarted our social media campaign, and he's very facile with Twitter and Facebook, and so now we're back out there. You have your annual report. I believe it was sent out electronically earlier, but you should have a hard copy today. We're glad that project is complete. In terms of other things to talk about CPRIT's accomplishments, I've mentioned this before, and we're working on an accomplishments report that is a much briefer document. It's not quite ready today, but will be right after this meeting. We want to update it with some of the numbers and awards that you will be making today. And for some reason, Wayne didn't like a maroon color, so we'll be changing the color.
He didn't suggest orange, did he?
Director's prerogative. No, our communications contractors have told me I can't have orange either.
Not in the color palette, but we can stay away from maroon.
Color palette.
In addition, some of your handouts, we have a very basic slide deck with some information about CPRIT should you need some slides for presentations. We're happy to help you tailor things anytime you're preparing to speak somewhere. We also have compiled some of the grantee highlights. You had asked for more examples of work that our grantees are doing. So in your packets, we've also compiled more of that. In addition, we're working on another slide deck. Dr. Rice had some really interesting slides we want to borrow and use some points from his slides to create another presentation. And we also had a request, and we're working on some sort of prepared speeches should you be asked to go anywhere and speak about CPRIT, things that we can customize and tailor very quickly to your needs. So please let us know whenever you have a need to speak about CPRIT. Tell us what audience. We just need a day or so notice, and we can turn something around for you pretty quickly. We're also working on more of, the patient public impact stories. We've reached out to our grantees to identify a few people who would be willing to share their images, and tell their stories, and we could use their photographs or maybe a little videotape of them. So those are all things that are in the works. We've talked about the PBS cancer documentary, and plans are proceeding for that. Our Save the Date went out so far. Just with the Save the Date, we have about 65 responses, people who've already RSVP'd. And we're working on finalizing the panel discussion, the panelists for the panel discussion. And as soon as we finalize those people, we will put out a more formal invitation listing who the panelist is. who the panelists are. The CPRIT conference, I think Heidi just told you, we've signed that contract. Thank you very much. Now we can get that save the date out and really get rolling on the conference. I believe some of the subcommittees have had an opportunity to discuss potential content and speakers, but please, as you think about that, provide us your ideas, and we will have to get started pretty quickly on that and start inviting people. So,
Is the invitation list grantees?
To the conference?
Yes,
Or?
sorry. Yeah, to the conference. Is it just all the grantees, or who else would be invited?
It is broader than that. Our grantees, we strongly encourage to come. They can send up to 2 people with grant monies, but we invite everyone in the state, accompanying states, if they want to come over. We'd love to have, just anybody who's interested in research, prevention, or product development programs attend. So that is my communications report, if you have any questions.
Questions, comments? If not, we'll move on to item 9, which is also Dr. Garcia, and now we'll move into the program activities section, and she'll begin with the prevention program report.
Thank you. We don't have any awards for you before you today, but I'll just give you a brief update on some of the activities in the prevention program. We are right in the middle of our review cycle. Actually, next week, February 23rd through 25th, we'll be in Dallas conducting peer review. Invite, again, any of the board members who are interested in stopping by to do so. We'll be at the Hyatt Regency downtown. And so the results of their recommendations will go forward to the PIC and then come to you, the Oversight Committee, in May. And at the same time, we are getting ready for our next review cycle. We are currently revising our requests for applications that will be released in April. We've had some very good discussions about some revisions to those to really align with our program priorities. And one of the things that we are adding to our areas of emphasis is including screening for hepatitis B and C for the prevention of liver cancer. Then just one other activity that I'll report on. I've mentioned this before, but because discussions are progressing well with the College of American Pathologists, we are continuing to discuss the collaboration on a project they called CPRIT. It's a breast and cervical cancer screening education program. It's a one-day program where they will bring in women and families, screen them for breast and cervical cancer, and try and get results back to them that same day. So the pathologists are there, they're reading the pap smears, the radiologists are on call to read the mammograms, and while the women and their families are waiting for their results, they have educational programs going on, healthy living, healthy cooking demonstrations going on. And so it's a very innovative project. They have tried it and tested it for a couple of years now, and I think they've gotten it down to where they're very comfortable with how to run the program. The applications would come to us, come through our normal review process. The CAP would provide technical assistance in helping the different sites and clinics implement the program. So we think it's a very nice collaboration. They're small projects. The maximum award would probably be about $20,000 per project. So with that, I'll end my report and answer any questions.
Thank you, Dr. Garcia. Are there questions, comments? Thank you very much. All right, we'll continue to proceed to item 10, tab 7, and we'll recognize Dr. Kripke to give the Chief Scientific Officer's report. And they'll introduce, she and Mr. Roberts will introduce the Program Integration Committee's grant award recommendations for academic research grant awards. Good morning, Dr. Kripke.
Good morning, members. I'm Margaret Kripke, Chief Scientific Officer for CPRIT. Looking at your agenda today, I will try to be as brief as I can. Let me start out by saying that we also will be in peer review in Dallas March 8th through 18th. And at that meeting, we will be reviewing the high impact, high risk grants. There are 100 of those being reviewed. There are 17 applications for core facilities awards, and there are an astonishing 42 applications for multi-investigator research awards. So it's a huge compilation of grants, and of course is one of the reasons that we're a little nervous about how much money we will have at the end of the year, because the multi-investigator awards are very, very large. So that's ongoing. We will also by the end of this week, put out our next set of RFAs. These will be for the research training awards. Our existing awards are due to expire, and this will allow groups that are competitive to continue those programs. This is a five-year award. It's also open to additional new programs as well. The other grants in that cycle will be individual investigator awards. Again, that will be a year since we offered those the last time, and they will include both untargeted awards and targeted awards. And the targeted awards will again be for prevention and early detection, for childhood and adolescent cancers, and a new one for computational biology in accordance with the priorities set by the Oversight Committee. I want then to focus with you on a couple of items. There were some additional handouts at your seat. One of them is a table that looks like this. Doesn't have a label on it. It belongs in tab 7, and it's the listing of the recruitment awards. And these are the recruitment awards that you have approved. You approved at the November meeting, and at the bottom are the ones that you have before you today. And I just thought you should have a status report of where we are with these recruits. As you can see from the November group, 3 have accepted. 2 are, actually 3 are pending, still pending a decision. 1 declined, and there was 1 that declined prior to Oversight Committee approval. So that's the status of those. And then in today's group, we've also had 1 application withdrawn. The candidate accepted a position elsewhere about 2 days ago, so that one was just pulled from your voting agenda as well. So we have 3 more that we'll act on today. And in the works, we have more. There are 5 that are pending review by the Scientific Review Council. There are 2 more that are in progress that may be submitted before the next deadline. And the total amount of money for all of those is another $26 million. So again, this is the big recruitment season for academic institutions, and so we're likely to see another larger bolus of those coming through at the next meeting. Are there any questions about the recruitment awards? We'll be voting on the ones at the bottom of the page in a few minutes.
Could I just ask you to go back a moment to how the Oversight Committee priorities have shaped the RFAs going forward? You alluded to that and touched on it briefly, but could you?
I'll get to that in just a minute when we talk about the research grants, and then we'll discuss that in some detail.
Okay, on recruiting and research.
We have not really addressed the priorities in the recruitment. And we could decide to do that. I think that would be a subject for the research subcommittee to take up. If we wanted to encourage recruitments in specific areas, we certainly could do that. Again, we're pretty much limited to who's in the pipeline and who the universities are trying to recruit. But that I think we could certainly have a discussion about that. To date, we have not done anything in that regard.
Well, I remember just a sidebar conversation with one of the university representatives in the meeting when we approved the priorities, and she said, the universities would embrace that type of guidance, and that's just a person from one institution. But I think when the Oversight Committee passed those priorities, it was intended to embrace all of our areas of work to the extent possible. So I would think that if we aren't going to use it in the recruitment, that we need to consider that and make an exception for that. But I think in the absence of an exception, it was the expectation, at least of this Oversight Committee member, that it would influence and shape the decision-making for across the entire span of CPRIT work.
I think that occurs now at the level of the Scientific Review Council, which does know our priorities. They have a list of the priorities, and they take that into consideration during their discussion. But we have not addressed it in the RFAs that go out for recruitment. So we can certainly discuss doing that if you'd like.
Well, I would, Mr. Chairman, it was my understanding that it would shape our work across all areas, and that if it's not going to be in the area of recruitment, I'd like us to consider an exception to the application of our policy. I personally would not support an exception such as that, but I think that it was at least my understanding that it would shape all of CPRIT's work. And if so, I guess I just posed to you, I don't know what your expectation or understanding is, but I think that is a way to bring synergies across the whole CPRIT portfolio, and in just one member's perspective. But I do think if we're not going to do it, we need to consider an exception to the application of the policy.
Thank you. Yeah, I think that it occurs to me that we hadn't really thought of it that way. In other words, applying those to, I think we developed those, and I was thinking of those as directionally helping the RFA development, but I hadn't thought about it as applying to the recruitment side, which is perfectly fine. And so I appreciate your highlighting maybe something we just hadn't considered in that way. And we should maybe bring it back to the subcommittee and just develop that idea. I think in the absence of an exception, I think maybe we should go back and sort of repaint that corner of the picture, so to speak, to make that apply there. And maybe we just hadn't done that yet because we hadn't thought of it.
I think we also might want to take that to the University Advisory Committee and see what the issues would be on the university side for that, for doing that.
Yes.
It was a person who was on the University Advisory Committee that I was, and you may have been a part of that conversation.
Yes.
And she said they would certainly embrace that and would embrace that sort of guidance. But anyway, I just would like to see our areas of emphasis applied as across all of our work. That was certainly my understanding, that there were no exceptions to that. And it's not a straitjacket. It's areas of emphasis, and recognizing that it couldn't apply to every single thing that we do, but to the extent we can apply those areas of emphasis and achieve synergies across the whole CPRIT portfolio, we have a better chance of making a difference in those areas that we've decided that are our priorities.
Yes,
But it's not the case that the priorities are being ignored. I mean, it's just, I think, Mr. Guerin, you'd be talking about shaping the RFAs, going from the Scientific Review Committee, which does consider the priorities, down to the shaping of the RFAs.
The RFAs are the only way that we actually have an impact as far as how our grants are applied. So.
Well,
if
the RFAs come, if the applications come up to the Scientific Review Committee, they do take into account the priorities when approving or rating the applications.
Yeah, but our RFAs would be the way that we signal to the scientific community, here are the areas we would like to see you paying attention to. We talked earlier about there are certain areas that we might think are important that there isn't much activity going on. And by having RFAs that offer research money there, it could attract funding into areas that currently are under-resourced for a lot of market reasons. We could have some priorities that the market doesn't adequately address just because the region that it affects or the narrowness of the impact of the cancer, but it could be very important to Texas.
Right.
So I would expect that, and when you talk about your RFAs in the materials, you have RFAs that speak to specific areas of our emphasis, the pediatric, for example.
That's correct.
But repeating myself, but I do think the recruitment, I would think that would be an area where we really could advance our priorities by bringing the top people in the world to Texas to work on priorities that we believe were reflecting the needs of the people of Texas in the areas of emphasis that we decided upon. And that could certainly be a way to move the needle.
Great comment.
Thank you. So we'll put that on the agenda for the next research subcommittee meeting, and we'll take a look at the RFAs and see what can be done with that. Thank you. Anything else about the recruitment portfolio? Okay, then I'd like to move to the complicated table that says tab 7 on it. It's got several tables on it, and this is a compilation of data from the research grants that you will see today. And I'd actually like to start in the middle of that page where it says 15.1 success rates by mechanism, and just sort of walk you through what we're talking about here. Are we all on the same page? It says tab 7.
It's the first page of tab 7.
Yeah.
I don't have this one. I don't.
Got
Okay, everybody on the same page?
Y'all go ahead. I can be
Okay.
backfilled.
Okay. The success rate table, which is in the middle of that page, looks at the number of applications being proposed for approval by the Scientific Review Council divided by the total number submitted. And so that gives us a success rate. How well did those applications fare in the hands of the committees? And you can see that for the untargeted individual investigator awards, from the peer review panels, there was initially a success rate of 15.4%. They approved, that's the percentage that they approved from those awards. The Scientific Review Council decided that that was a little too generous, and they actually reduced the number of grants before forwarding them on to the Oversight Committee. And so the final number that's being recommended to you today is 36 applications out of the submitted 271. So the success rate is 13.3% for those applications. For the targeted applications for childhood and adolescent cancer, the success rate was initially 21.4%. That went down to around 18% after Scientific Review Council met. And so what you will be looking at are 10 grants being proposed in that specific area out of a submitted 56 grants. And the same for the prevention, the original success rate, 12%. The SRC recommended reducing that to 7.6%. And so we have ended up with 5 of those applications out of 66 that were submitted. So overall, what you're looking at today that we're asking you to approve is 12.9% of the submitted applications, or 51 out of the 393 that were submitted. So the Scientific Review Council, again, in anticipation of a large request for funding in the second part of the year, and also with the thought that the overall success rate of 15.8 was much higher than they had seen before, reduced the success rate to around 13%, which is what it was in the last round from last year. And so the Scientific Review Council has already pared down that list by $12 million and 11 grants removed from from what the peer review committee suggested. So that's what we're asking you to approve today.
Margaret,
Yeah.
to put these numbers in perspective, what's the current NIH funding rate?
Oh, it's single digits. It's actually single digits. It's below 10% at this point for the R01 pool. Yeah.
For the R01 pool?
Yes, for R01s, right. If you look at the little table at the bottom of this page, it just tells you what percent of the grants we are hoping to award today fall into those three categories. So 70% of the grants, 70.6% of the grants are untargeted. Almost 20% are targeted toward childhood and adolescent cancer, and almost 10% are going to prevention and early detection. Now, if we go up to the table up top, it gives you an idea of how we're doing with our priority areas. And the top table that says research area is information that we collect on the grant applications, and the applicants check a box for which area that they believe their grant best fits into. And so the areas are cancer biology, cancer control, and so on. So we do have a category here for prevention, and if you look at prevention, you can see that in the previous cycle, there were no grants awarded in that cycle for prevention. And in this round, we are requesting an award of 4 grants for a total of 8% of the grants being funded in the prevention area. And if you continue in that column, you'll see the dollar amounts represented there and the percent of dollars. So for prevention, pure prevention grants, 10% of the portfolio for this round would go to prevention. We also have, so our RFA was for prevention and early detection. And so that is actually what you see down below where it says program priority area. And this is the kind of presentation that we are proposing to provide to you so that we can monitor how well we're doing with the priority areas. So far we've really only addressed those 2 priority areas, childhood and adolescent cancer and prevention and early detection. In the next round, we can add computational biology to that and so on, and what are there any other areas that you would like to see. But if you'll, I think my conclusion is that putting out an RFA specifically targeted, particularly to childhood and adolescent cancer, has had a very large impact on the number of applications that we received and also the percentage that are coming forward for funding. So if we look under program priority area at the childhood and adolescent cancer, in round 14.1, that's a year ago, there were only 2 applications that came forward for funding. And in this round, there are 10 that are coming forward for funding. So 20% of the applications are for childhood cancer, whereas in the last round it was only around 4%. And again, you can see the dollar amounts associated with those. For childhood and adolescent cancer, it's actually quite large. Only 3% of the money in that round went to childhood and adolescent cancer, and this time 31% of the funding will go to childhood and adolescent cancer. So I think we've made a big stride in terms of advertising our interest in this area. We've had a very positive response from the clinical and scientific community in that area.
Dr. Kripke, just for clarity so I can understand, so for the dollars that we awarded to childhood cancer in the most recent round, 14.1, in this round we're going to deploy about 10 times as many dollars as we did that time?
That's correct.
Okay, thank you.
Yes.
Mr. Chairman, just on that point, I commend Dr. Kripke and her team for that. Is just a great example of taking a concept and turning it into action. And it shows how much you can.
We've made a few people in the room very happy with that, right?
And thank those our folks who fought so hard for that issue. But it shows how CPRIT can shape the behavior of the research community with our RFAs. And so I commend you all for your work, and we've already had an impact on the pediatric research just by your RFA. And I think it's an example across our whole portfolio how we can use our bully pulpit to move research into areas that the Oversight Committee has decided are important. So that's just the best affirmation we have of the impact in that one area in one round of RFA. So
Right.
I just think we should look for every opportunity we can to not only just respond within our areas of emphasis or with the consideration of our areas of emphasis, but let's try to shape behavior out there. And this is a great example of how we're able to do that.
Well, let me continue with looking at prevention and early detection, where it's not quite as stellar a result as we've had with childhood cancers. And if you look at the combined totals for prevention and early detection, we had quite a number in the round previously. And so we've moved up from 13% to 18% in prevention and early detection. We've also moved the dollars a lot. If you see the 14.1, 12% of the dollars went to prevention and early detection, and this time 21% of the dollars are going there. That's because we made those grants larger and longer. But I think it underlies the fact that we don't have as much work available to be submitted in the prevention area as we did in childhood cancer. And I think the difference is that we had perhaps people working on clinical projects, busy clinicians who didn't bother to apply to CPRIT for grant funding, who saw this as an opportunity and then applied. But if they weren't working on that already, there wouldn't be a pent-up demand for that area. So I think we need to keep pushing on the prevention and early detection front, and I think your suggestion of perhaps having some emphasis in the recruitment area, that would be the area I think that would benefit, because it doesn't seem like we're getting a huge amount of response. On the other hand, we do have some in prevention that are coming through in the multi-investigator award group, so we'll have to see how that plays out. I think that's the end of my report, unless there are other questions or comments.
I also want to congratulate you. I think this is very impressive. I'm looking at the research program priorities and on these pretty paper that Becky had sent out, and I'm seeing that one of them is cancers of importance in Texas. And I'm wondering, Margaret, if any of these research areas that are under the categories of cancer biology, cancer control, and survivorship also would fit under our priorities of cancers that are important in Texas.
Yes, they do, and I'll just give you one example. The largest number of grants addressing a specific cancer are addressing lung cancer. Breast cancer runs a close second, but lung cancer is actually the cancer for which we have the most research projects in our portfolio, and that would be on our list of cancers of importance to Texas. We have not done the analysis yet about where we are, and that's why we've not put out a target at RFA in any other area yet except for computational biology, because we need to see what we already have in our portfolio and to see whether there's a need to really stimulate additional work in specific areas.
Could you, in the presentation, you used lung cancer as an example. Could the presentations, just as a matter of course, include any of the research projects that do check that additional box of a cancer of importance
Yes.
to Texas?
Yes.
Just make that
Yes.
part of the regular reporting, and not just, cancer biology, but of those, which one of those also impact one of the areas of emphasis.
Yeah, in addition to the checking those boxes, we also have a list of cancers, so that where people also check the box of what type of cancer they're working on as well. So we have those data.
Well, I guess I'm just asking, would you make that part of the presentation to us?
Yes, I'm trying to figure out how well, let us work on that and see how we can do that.
Well, you
want
gave
it
an example
for
to
each
Dr. Mulrow.
grant?
You said,
Yeah.
lung cancer is an example of one that happens to hit a cancer
Yeah.
of high incidence in Texas.
Yeah.
Well, I assume that you could say that was an example, but you would have a record of every area of
Yes,
research.
yes,
And
we can
so-
make the same kind of table for the various kinds of cancers, yes. Yes.
And highlight the ones that are of significance to Texas,
Certainly.
particular significance to Texas.
Certainly.
Okay, thanks.
We can highlight rare and intractable cancers and cancers of importance to Texas.
Would you
Yes,
do
we
that
can
as a matter of
certainly do that.
routine?
Sure,
Because I think
sure.
that really will
Yeah.
inform us.
In fact, we can follow up with this round, now that we have these data, we can follow up with this round and show you how things have changed or remained the same from the last cycle to this current cycle. So we'll provide you with that information subsequently.
Yeah, I'd like to see, Mr. Chairman, at the end of every year, a wrap-up
Yes.
of everything that we've done over the course of the year and put it into the categories and see how we're doing
Right.
in those,
Right.
what areas we're able to do a lot in and other areas where we're not.
Great. Maybe we'll get a draft for the next meeting.
Again, we'll put that on our list for the research subcommittee and
Yeah.
decide how you would like to disseminate that to the group.
Good.
Well, Mr. Chair, I mean, I'm looking at Dr. Kripke's table, and I've made a note that I envision something like this for each of the programs. Not sure we got something like this for this meeting for them, but I think she's done a good job of providing data that I'd like to have across all of the programs. As I said, I don't think we're going to have them for you today, Mr. Guerin, but we will try and make this a routine report.
Yeah, I think it'd just be a great retrospective as we wrap up every year, look back on how we were able to
And it's
perform
going to
against our
dovetail
priorities.
into our annual report material anyway.
Okay, that's the end of my report. I'm not sure what the process is for moving forward with the grant approvals for the grant applications. I think,
We'll go ahead and have Mr. Reisman
Yes.
give us his compliance certification. I'm sorry, before we go?
Have her lay out the recommendations.
Okay, but did you have a question?
Margaret, just a couple quick questions.
yes.
Well, first, thanks for an excellent report. I really enjoyed it. When you review the research grants, do you look at try to develop a portfolio of different mechanisms? And the reason I bring that up, it looked like on the last few cycles, there were a lot of grants that dealt with epigenetics. And it looked like they came out of the same lab areas. And it seemed like there were several labs, people in those labs that may have been getting several different grants. I was just wondering, do you look at, we're going to do so many epigenetics, so many
No.
stem cells,
No.
so many...
No, we don't try to do that. The only thing that we have done recently is we've noticed that there are a few investigators who have a number of CPRIT grants, and so we have put into our latest RFA that should come out this week that they are limited to 3, a maximum of 3. So if they already have 3 active grants, they are not eligible to get another individual investigator award.
Does that include, say, like, you're in a big research lab? and
No,
there's-
it's to
and
the
there's-
individuals.
Okay,
It's
so...
to individuals.
So researcher A,
Principal
B,
investigator.
C, and D in the same lab,
Can all get grants if warranted.
okay.
Yeah, yeah.
And also, when the committee reviews the grants, is there any information provided on whether this grant has been reviewed previously by, say, like the NIH or other granting bodies?
No, they're required to state if it is pending somewhere else, if it has been, if it's in submission simultaneously somewhere else, that is required, they're required to report that. But they can have a grant that's, turned down by another agency and submit it as a grant to us.
Is that information that you request on whether this has been reviewed and turned down?
No, we don't. And part of the reason is that funding is so hard to come by these days that it almost doesn't matter whether it's, there are a lot of things that are certainly worthy of funding that are being turned down at the NIH.
True, but I just thought it's another metric to look at.
It would be voluntary reporting. So I'm not sure how many people. Well, also, Craig, the point is that when you get a grant back with a rejection, you get comments, and so if you are a reasonable researcher, which most of our people are, you would make extensive revisions of the application before it would be resubmitted. So it's not exactly the same grant as it was before. But no, we do not collect that information.
Right. Thank you.
Any other questions, comments? So just the process here, again, I think we have a slate of individual investigator award recommendations from the PIC, and we have a slate of recruitment recommendations from the PIC. And so, Margaret, if you want to add any more clarity, those are the two things we'll want to do. We'll get certification from Mr. Reisman that the process has been followed tightly through our pedigree. And then we'll do our usual exclusion kind of process to get everybody's positioning and exclusions before we vote. Any other comments?
What we're working from now is this document that says grant recommendations that gives you the details of the applications.
Thank you. So, Mr. Reisman, are you going to give us a certification of both, or where are we now?
Yes, but I thought since both were covered, I could go ahead and give a certification for both the recruitment and the research applications.
Okay, just hold on one second. Council's whispering in my ear. Okay, Margaret, are there any other comments you had for the two slates, I guess is the, I don't have this.
I'm sorry?
Are there any other comments on the two slates, the individual investigator slates, which would have those three different types?
Three different types,
and then and then the recruitment. Do we want to have her comments just to introduce those one more time to us, how many there are, and whatever detail you have there?
Sure.
I'm sorry.
For the individual investigator awards, we are bringing forward for your approval 36 untargeted individual investigator awards, 10 addressing childhood cancer, 5 addressing prevention and early detection, for a total of 51 applications.
Thank you. And then for the recruitment?
For the recruitment, we have 3 candidates coming forward for your review. They are all first-time tenure-track faculty members.
Right. And thank you. And again, we've seen those in our web-based informational materials, and the recruitment ones are listed here again. And then Mr. Reisman now can give us the certification of the Chief Compliance Officer for the pedigrees of each of those.
Okay. Yes, thank you. My name is David Reisman, Chief Compliance Officer for CPRIT. I reviewed the compliance pedigrees for the grant applications submitted for the slates just mentioned with for the recruitment and research awards slates. I have conferred with staff at CPRIT and SRA International, CPRIT's contracted third-party grant administrator, and studied the supporting grant review documentation, including third-party observer reports for the peer review meetings. I am satisfied that the application review process that resulted in the applications before you submitted by the executive officer followed all applicable laws and agency administrative rules. I hereby certify these award slates for the Oversight Committee's consideration.
Thank you. And just for clarity, again, I know that the Oversight Committee is aware, but behind tab 7 are those third-party observation reports as well as the pedigree for all of the grants under discussion at this moment for the individual investigator or the recruitment. So at this time, we'll note that the Oversight Committee members, there are Oversight Committee members that have reported conflicts of interest. Some of the applications to be considered, specifically Ms. Mitchell reports conflicts submitted by the following institutions: Baylor College of Medicine, University of Texas at Austin, the Health Science Center, University of Texas at Houston, the Health Science Center at San Antonio, University of Texas Medical Branch at Galveston, MD Anderson Cancer Center, Texas Southwestern, University of Houston, Texas Tech, Health Science Center, Texas Engineering Experiment Station, Texas A&M University. So in accordance with the CPRIT rules, Ms. Mitchell is recused from the discussion or action on these applications. Additionally, Mr. Angelou has reported a conflict of interest with the designated grant application RP 1504346. And it's been corrected in my copy to say 346, but thank you. Apologies for that. So members, a list of the identification numbers that the members report conflicts has been placed at your desk, and we'll sign those at the end of the meeting and require that this be included in the certified copy of the minutes. And are there any other conflict of interest declarations that oversight committees need to make at this time? Seeing, hearing none. So again, this is the approval process for the individual investigator awards for the prevention and early detection and for childhood and adolescent cancer. You have the list of applications before you. The PICS recommendations will be approved. 2/3 of the oversight committee members vote to approve. Rather than taking up individually, we'll take them up as a group. So we'll take a motion at this time to approve each of the PICS recommendations for the individual investigator grant awards for applications submitted by Baylor College of Medicine, University of Texas, as you read here at Houston, University of Texas Health Science Center at San Antonio, University of Texas Medical Branch at Galveston, University of Texas MD Anderson Cancer Institute, Southwestern Medical Center, University of Houston, Texas Tech University Health Science Center, Texas Engineering Experiment Station, Texas A&M University, and I've added University of Texas at Austin. So is there a motion there?
So moved.
Thank you. Is there a second? All in favor, say aye.
Aye.
All opposed? None. Motion carries. Thank you. We'll note for the record that Ms. Mitchell abstained from voting. And we'll proceed now to the recruitment grant award recommendations. And we'll note for the record that the Oversight Committee members there are Oversight Committee members who reported conflicts of interest. Specifically, Ms. Mitchell reports conflicts of interest with the applications submitted from University of Texas Southwestern Medical School and Texas A&M University. In accordance with the rules, she's recused from discussion of these applications or actions. Are there any other conflict of interest notifications that need to come forward at this time? Seeing none, you have the list of applications and grant amounts recommended by the PIC on page 13 of the packet at your seat. PIC's recommendations will be approved if 2/3 of the Oversight Committee approves it. Rather than taking up individually, we'll take them up as a group. And I note for the record that Dr. Kripke has reported that recruitment candidate associated with RR 150025 notified the institution after the PIC meeting that she has declined the appointment, as was discussed. Therefore, will not vote on that one. So at this time, we'll take a motion to approve the PIC's recommendations for recruitment grant awards and award amounts.
So moved.
Thank you. Is there a second? All in favor, say aye.
Aye.
Motion carries. Any opposed? Motion carries. I know for the record that Mrs. Mitchell abstained from voting. Thank you. So having approved the PIC recommendations for the individual investigator and the recruitment grant awards, need a motion to delegate contract authority and contract negotiation authority to the Chief Executive Officer and CPRIT staff, and to authorize the CEO of CPRIT to sign the contracts on behalf of the Institute. May I have a motion?
So moved.
Thank you. Second? All in favor? Any opposed? Motion carries. Thank you. So, great. So we're going to pause for a second. We're going to take a 10-minute break. We're going to move into the contract discussion and educational training. Is that right? I'm sorry, number 13, item 13. So we'll come back to 11, but we'll go to item 13. But let's first take a 10-minute break, and then we'll come back, we'll grab lunch, and then we'll come back and continue with item 13 because we have a video to watch during lunch. Yes, sir. I believe so. So we'll be in adjourn. We'll be whatever. We'll come back in 10 minutes.
Under tab 10, there's a memo there that's the service contracts overview. And there's an attachment to that provides the information about the contracted services that CPRIT has procured since 2009. There are about 25 vendors. I'm not going to go into detail on any of them unless you have questions, with the exception of SRA International, because Dr. Rice had asked to kind of lay out the history of the growth of this contract. And again, this is the attachment right behind the memo. SRA is our vendor for pre and post award grants management support services. And we started that contract in June of 2009, so it was the last quarter of fiscal year 2009. And so that amount of $500,000 represents kind of the initial implementation of the contract and developing the initial RFAs for the research program, which were actually published in August, and then peer review for the research program moved forward in the fall of fiscal year 2010. And so fiscal year 2010 represents the first year that the research program was fully operational, and then prevention was also getting ready and issuing RFAs being developed. Some differences that help explain some of the growth of the contract. The research peer review has always been conducted in person. Prevention peer review was initially conducted only via telephone conference call. They did not meet in person. So there are some initial differences there. Also, this first year, SRA did not support the product development program. Moving into FY11, product development was added as one of the support services that SRA worked on. And so we had, I believe, one cycle for product development in FY11 that was supported by SRA. And then moving into FY12, we actually started adding more cycles for product development in particular. And we run all of our honoraria costs for peer reviewers through SRA, with the exception of our chairs for each of the councils, as well as all the travel costs for those meetings. So that also represents some of the additional costs. And then in FY13, we added the evaluation of the research progress reports to the SRA services contract, because they have scientific personnel who could do a full review of those of those progress reports that are submitted annually for each award, and then provide those reviews to our chief scientific officer. And so that prior to that, our reviewers, the peer reviewers, had actually been helping review those progress reports, but they were not doing a full evaluation. It was just continue to fund or not fund was the extent of the evaluation, and that was the subject of the state auditor's report. In FY14, this is after the moratorium, restarting our program, as well as implementing many of the recommendations that were in the state auditor's report, as well as SB 149 in our grants management system to address compliance. And then FY 2015, the current year, represents actually having 6 cycles of product development reviews during the year, which is the most we had ever planned on. It appears that we will not have that many cycles, but this was half of those were anticipated to be company award cycles, and half were anticipated to be ETRA award cycles. So these amounts to are contracted. They are up to that and not to exceed unless we amend the contract for some reason. So obviously, if we don't, if the services aren't rendered by SRA, we will not pay until they are rendered. Are there any questions about the chart? Or one thing I should point out is anything that's kind of highlighted in green are our current active service contracts for the current year.
So just for clarity, these 2 pages or 3 pages is kind of our history of contracts. The green are the live contracts, and other things that CPRIT buys or would have there are things that CPRIT doesn't have contracts for that are not on this list, but that would be like when we buy supplies like pencils and paper, things like that comes through a Texas state kind of system that's not a contracted system like this. Is that right? I mean, I was trying to understand, are there any other big buckets of contracting that we're not seeing here?
Right. So for supplies, the controller's office, they have a central procurement office for the state, and they issue the guidelines and they do the training that you'll have today. But they actually negotiate term contracts for the state. A lot of those deal with just basic office supplies, and so we use those term contracts. The agencies actually have to use those term contracts for purchases because they haven't already negotiated the best price. And so we utilize that to make those purchases, and they don't obviously get into the tens of thousands of dollars at any given point. We also use contracts. The Department of Information Resources has contracts for IT services as well as the technology, the computers and things, so we can use those contracts as well to purchase those kind of commodities.
And just wondering about, so those kinds of contracts, do any of those amount to millions of dollars or hundreds of thousands of dollars or?
No, they have not.
I'm just trying to get, the question I'm really asking is do we now substantially understand with these 3 pages the significant contracts that come through CPRIT? And I guess I'm just finding significant as anything maybe over $50,000 or $100,000. And again, I defer to the group to decide if that's the right question, but just trying to get a sense of, if this is pretty much the picture.
I think this is pretty much the picture. We could, I mean, again, we do have some smaller contracts listed on this on this chart. We could add some of those other that information if you'd like, just for completeness, but.
The will or the thoughts of the board, just because obviously contracting is a very interesting issue at this time, so to speak, and so we want to make sure that as an oversight committee we're deeply aware of of this part of our ecosystem for our agency, and defer to you to tell us if we're missing something. And again, I'm not.
One thing I will say, we try to, we don't try, with the audit subcommittee, we do bring forward all contract, procurements that we're doing, both those under 100,000 and over 100,000. Anything over 100,000, the audit subcommittee needs to review and make a recommendation to the oversight committee to approve, and then we bring those kind of contracts to the oversight committee for approval. So, in terms of that, I don't think we'll ever run into the situations that.
Okay, thank you.
One thing I'd like to add, in addition to, the presentation of contracts to the audit subcommittee, as you know from this week, because of Senate Bill 353 and Governor Abbott's letter to all state agencies, we are implementing the provisions of 353, one of those which requires or prohibits an agency from contracting with an entity or a person where there is a financial interest of a governing board member or of key senior staff. And so we need to inform you of contracts that we're entering into so that we can ensure that you don't have you or your family members don't have a financial interest in them.
Would the mere presence of a financial interest in the second degree of affinity prohibit the agency from entering that contract?
That's the way that the bill is written at this point. It's not a final bill, and may be changed before the end of the session, but pursuant to Governor Abbott's letter, they've asked all state agencies to implement it to the extent possible.
I just want to make sure that the Oversight Committee is comfortable with where we are on this whole topic. And the only caveat I'd have, which we've discussed before, is that, what I'm not sure of is some of the details. So this doesn't apply to me, but, we had a recent contract with a hotel, and and maybe somebody it's a public company, and somebody owns 10 shares in a public company, that would technically, I think, in that bill, define a conflict, even though it's clearly not a practical conflict from that point of view. So some of that still needs to be defined, I guess.
Yeah, some of that will need to be worked out by the legislature. There are some state statutes that will talk about financial interests, but then will exclude things like, shares held as part of a mutual fund or things where you don't really have control over that. And so it may be that by the time this legislation gets passed, there'll be some more guidance on that.
Just example of how far the federal government has gone. Say if you're an appointee for the Department of Defense, you can't own a share of Coca-Cola stock because they serve Cokes on military installations. So I don't know if our state government is going to go that far down the. But when you think about the hotel, they consume all sorts of services. So do you get beyond the ownership entity, which the federal government actually does, in setting their limitations? So as tough as this sounds and it's as written, it wouldn't be unheard of if they did have something that's as onerous as this could prove to be.
Thank you. Very interesting. Okay, other comments or thoughts before we move into the next exciting adventure here?
I've been waiting all morning.
I think we were already talking about SB 353, but the only other thing I'd like to point out on the back of the second page of the memo is that there are new provisions for agencies to follow regarding historically underutilized business. These are reporting requirements that are actually in both versions of the introduced budget by the House and Senate, and so requires that the agencies do a self-assessment of our HUB program and how well we're trying to make purchases from HUB vendors. It will also require each agency to submit a report before December 1st, 2015, that demonstrates our compliance with state HUB policies and include a plan to maintain compliance and a good faith effort to increase HUB participation. So that's an additional reporting requirement that the agency will have to follow.
Thank you. Questions, comments? That concludes your preparatory comments for the contract training?
That's.
Do we want to go ahead and just move right into that because of...
If I can, I'd like to bring Cameron Eckel up. She'll just explain what sheet you have to fill out and provide to us so that we can document that you've received the training.
I placed a form on each of your desks. It's a one-pager with a little flag on it. If you could sign it after the webinar and return it to me, that will serve as your certification to the Comptroller's office that you're fully trained on state contracting.
Thank you. 159. I'm not sure where in that page we are, but I believe we're going to go back to tab 11 and
Item 11.
Item 11, tab 8. Is that where we need to be?
Yeah, just for the record, I assume that there was no action
sorry.
that you need to take.
Correct, and no
after
action
the closed session.
after the closed session.
Okay.
And Chair recognizes Dr. Tom Goodman, CPRIT's Chief Product Development Officer, to present his product development program update and lay out PIC's recommendations for the product development grants. Good afternoon, Dr. Goodman.
Good afternoon, Chairman Rice and members of the Oversight Committee. For the record, my name is Thomas Goodman, and I'm the Chief Product Development Officer here at CPRIT. I would like to begin my presentation by giving a brief update on the activities within the product development program. The memorandum on the subject is at tab 8 in the meeting booklet, and you can follow those points there. To start with, I'm very happy to report that several of the companies whose research projects were funded by CPRIT have had considerable success in the financial markets. In late 2014, for example, CellMedica received B-round investments of approximately $75 million. Bellicum, which has just completed its grant with us, did an initial public offering where they raised $140 million, and they're now listed on the NASDAQ. DNAtrix raised $20 million of private capital for its own war chest to advance its therapy to phase 3 clinical testing. These follow-on commitments of private money to what began as CPRIT research projects, I believe testifies to the quality of the investments that CPRIT has made as a result of its rigorous evaluation process. So with regard to the current grant applications in this cycle, fiscal year 15.1, in this cycle there were 30 applications received. The reviewers advanced 8 of those to due diligence. The first 4 of these were completed and subsequently approved by the Program Integration Committee on February 3rd. They are now subject of the memo to follow this introduction. The remaining 4 applications will be taken up by the Product Development Review Council probably in early April of this year, and they'll potentially be presented to the Oversight Committee on May 20th, 2015. In the next cycle of grant applications, 15.4, the application process just closed as of February 9th. In this cycle, we received 16 applications, and the first screening of these by the review panels will probably begin in late March of this year. Finally, in terms of the update, and in regard to the revenue sharing terms that were approved at the January 20th meeting of the Oversight Committee, external counsel has now prepared a new contract incorporating these changed terms and conditions, and we are going to be moving forward with our contracting activities just as soon as possible for the 6 companies that were already approved by the Oversight Committee for contracts, and hopefully also, with your approval today, for the 4 new companies that I'm going to go on to describe. At this point, that really sums up the recent occurrences, the recent happenings in the product development group. I think that we want to turn our attention now to the question of the early translational research applications, the ETRAs. In the last group of ETRAs, a decision was made by CPRIT staff that they would be transferred from the research academic research program being run by Dr. Kripke over to the product development program, which was being run by me. The rationale for the change at this time was multifaceted, but certainly contained the thought that the reviewers in product development were a tougher round of business people who would be able to evaluate these projects in terms of their business suitability and then make judgments based on that. We also had the feeling that we wanted these folks to actually prepare business plans. That was part of the request for applications, and we thought that those could best be looked over, commented on, actually assisted with by the product development group. That said, there are numerous reasons why this change has created some heartaches, not the least of which was the feeling that perhaps these were too early stage to constitute opportunities for actual company formation. It remains to be seen. We had 46 applications, 20 of which were actually approved by the product development reviewers. We're going to continue on with those, but we'll see how many of those actually materialize into companies, and of course the proof of the pudding will be in the tasting. So maybe I can pass this to...
Yeah, I think Tom gave a good overview of the background of these, but upon further examination, I think that I'm more comfortable with returning them over to the academic research program. The specific reasons are outlined on the second page of that memo, but a paramount issue here is the grants are going to universities as opposed to companies, and for consistency of the contracts that we have to work with the institutions. I prefer them being there for that, as well as for consistency and reporting purposes of items that we turn over, particularly to the Capitol building. The issue of peer reviewers, the adequacy of the peer reviewers is a valid one, but I think it can be addressed by any one of a couple approaches. We could either put more product development related people interspersed among those committees. We could create a committee of that's heavily product development oriented in order to get that expertise. We could even perhaps devise a way to use our existing product development reviewers on these as well. I think we can work that issue through to make sure that they do get the appropriate review that's needed. But for those reasons, there's no action that you all need to take unless you disagree with this approach. The staff has moved this over, and we can move it back.
Thank you. Any comments or questions? Thank you. So are we ready to maybe hear any details about the companies that are coming forth, or are we ready for, did you have something prepared for that, or are we ready for the certification by Mr. Reisman for the
I have some brief comments about the companies.
Okay.
Yeah, make it brief.
They're very brief. I'm gonna refer everyone to the handout that I think was at your places. This is labeled tab number 8, but it was not included within the booklet at this time. So I'll be referring to the page numbers on this. All of the 4 companies being recommended here come to CPRIT from the new company product development RFA. Again, I'm on page 2 of the memorandum here at tab 8. There were 30 applications submitted. In the first cut, the reviewers brought in 17 for on-site presentations, and of these, a total of 8 were recommended for further diligence. The 4 applications presented now have completed their due diligence process. They've been reviewed and recommended for funding by the Product Development Review Council and further recommended by the Program Integration Committee. The total amount requested for the 4 companies is $48.5 million. Now, the first company that I'd like to speak a little bit about is NanoTX. Radiation therapy remains an essential component in the treatment of cancer. And what NanoTX has succeeded in doing is developing a method of loading extremely radioactive 186 rhenium into lipid particles that are actually about 1,000th the size of a cell. These nanoliposomes, as they call them, can be injected directly into the tumor, and the tumor cells absorb them. They ingest them essentially and become irradiated really from the inside out of the cell. The benefit here for cancer patients from this technology is that more radiation can be delivered directly to the tumor and healthy tissue is spared. The first application of this technology by NanoTX will be in brain cancer. The company is going to be located in San Antonio and is requesting $2 million over a period of 3 years for clinical testing of the technology. It's worthwhile to recall that one of the important methods that CPRIT uses in managing the state's investment in these projects is tranching. I know that the committee understands this, and so now I'm speaking a bit for the benefit of those in the audience and others who might be following the recording here. CPRIT does not just write a check to these companies. Instead, we lay out as part of the contract, an integral part of the contract, we lay out goals and milestones that the company must commit to achieving. Progress reports on these milestones are written by the company and they're reviewed by our scientific reviewers. If the company fails to meet the milestones, funding is withdrawn. This tranching for NanoTX is described at the bottom of page 3 and then on to page 4 in the tab 8 memorandum that I alluded to, and I'm not going to repeat what was written there. There follows then a summary thereafter of the independent scientific evaluation and diligence on this project. Are there any questions that I might be able to answer about NanoTX's application? If not, I'm going to turn to the next company, which is Medicena. Medicena is also targeting brain cancer, and in this case in both adults and children. As it turns out, tumor cells have very high levels of interleukin-4 receptor on their surface. The technology that this company has employs a Pseudomonas exotoxin, which is fused to the interleukin-4 sequences. They're actually concatenated sequences. These interleukin sequences bind to the receptor on the surface of the cancer cells. The toxin is actually taken up by the cell, and the tumor cell dies. Medicena's drug, MDNA55, has shown very promising clinical results among 72 patients that it's been tested in for adult glioblastoma. The FDA has already granted MDNA55 orphan drug status and fast-track designation. So very consistent with our program priorities and product development, this is a project that is really relatively close to the marketplace. Medicena is requesting $14.14 million from CPRIT to support 2 clinical trials in glioblastoma patients. These trials will test MDNA55's safety, its dosage level, and its effectiveness. Medicina will be located in College Station, Texas. And the key milestones for this project are given on page 5 of the memo, and a description of the tranching then follows on page 6 of the memo. Are there questions that I might be able to answer about Medicina? If not, I'd like to describe the third company for you that's in the slate, and that is Armata Pharmaceuticals. Armata Pharmaceuticals is developing an antibody drug conjugate. This is called an ADC. This promises to have a great deal more efficacy relative to the currently marketed unconjugated antibodies, as well as hopefully to improve the safety profile relative to traditional chemotherapies. Armata's lead product, Avid 100, is an epidermal growth factor receptor targeting antibody that is joined chemically to the natural product toxin DM1. This conjugate has been evaluated in preclinical cancer models and has exhibited very good efficacy against many common cancers that express the EGFR receptor. These include breast, ovarian, pancreatic, gastric, and lung cancers. The benefit here for cancer patients is that compared to the FDA-approved anti-EGFR antibody, Erbitux, which, by the way, generates revenues of approximately $2 billion a year, Avid 100 showed quite clinically significant superiority in its activity, and including against models where there was a resistance to Erbitux. That was surprising and quite beneficial, we hope. This improved efficacy could be greatly helpful in addressing the unmet clinical need here. Armata Pharmaceuticals, which is going to be located in Houston, is requesting $12.75 million from CPRIT over a period of 3 years. This is going to be matched by $6.375 million from other sources for a total project cost of just over $19 million. You can see from the tranching of this grant amount at the bottom of page 8 there in the tab 8 memo. This project is not as advanced as some others. And the first tranche, for example, during the first 12 months of the study, the company is going to be completing GLP toxicology studies, and then at the end of that year submitting the IND, which will allow them to proceed to actual real human clinical trials. Again, a summary of the independent scientific evaluations found on page 9 of the memo. Comments on the diligence and recommendations for funding follow. Are there any questions that I might be able to answer about Armata Pharmaceuticals application? Hearing none, I'd like to turn to the very last company that is going to be recommended today, and that's Immatics Biotechnologies. Immatics Biotechnologies is seeking CPRIT funding for 2 projects. These are both in the field of adoptive cellular therapy. The projects are called Actolog in glioblastoma and ActEngine in pancreatic cancer. Actolog in glioblastoma is an adoptive cellular immunotherapy that uses antigen-specific autologous T cells for the treatment of glioblastoma. Antigen specificities are determined for each individual patient based on tumor and blood biomarkers. Specific T cells are enriched using a peptide and HLA multimer library, and they're expanded ex vivo before adoptive transfer into the patient. Personalization of the therapy is achieved through tailoring the choice of T cells to be transferred based on patient-specific analysis of the heterogeneity of the cancer in the immune system. The current plan anticipates a multi-target approach by applying at least 2 different T-cell products, chosen from a library currently of 71 different targets, to each patient. Such antigen-specific T-cells would be expanded ex vivo and then infused into the patient after preconditioning. The second project, or the second project that they're working on, is called ActEngine. ActEngine is an adoptive cellular immunotherapy for the treatment of pancreatic cancer. It uses, again, autologous T cells for each individual patient that are genetically engineered ex vivo to express an exogenous, and that is novel T cell receptors. How this works is blood cells from the cancer patient are harvested by leukapheresis, and autologous T cells are transfected with a vector system that harbors a new T cell receptor. Again, the current approach anticipates applying at least 2 different T cell products chosen from a library of initially 6 different targets to each patient. Personalization of the therapy is achieved through tailoring the choice of the T cell receptors to the expression of antigens by the individual cancer. Immatics Biotechnology will be located in Houston. They are requesting $19.7 million from CPRIT over a period of 3 years. This will be matched by $9.8 million from other sources for a total project cost of $29.5 million. Again, the tranching of this grant amount is described on page 11 of the memo, and I thought it was worthwhile to point out, and I will, with your indulgence, the scientific reviewer's comment that shows on page 12, where this individual says, "This is a highly innovative approach to immunotherapy using state-of-the-art methods and collaborating with highly regarded MD Anderson immunotherapy experts. This creates strong synergy. The disease targets are important, advanced glioma and pancreatic cancer." That is correct. It's from Houston, or will be located in Houston. Again, if there are any questions that I can answer, I'd be happy to do so.
Just one, Dr. Goodman. There are matching funds being made. Can you say generally where the matching funds come from? Do they come from other public sources or private sources, or is it?
They can and do come from a variety of sources. I believe with NanoTX, for example, there is public funding that is going to be used in the match. In the case of Imadix, this is a subsidiary of a company that is locating here to Houston from Germany. They're very much looking for a beachhead in this country to do this type of therapy, and MD Anderson provided a powerful magnet to get them in here to do their clinical trials. So they're looking to develop quite a program, quite a company, quite a footprint in Houston there. So money there is coming from a corporate source. In the other cases, I probably can look them up. I believe that Armada Pharmaceuticals is actually being formed by a merger between a company called Avid Biomedical. Armada is going to be a new company which will have Avid as a subsidiary. And so I believe that they bring along financing from some of their early rounds of investors. I'm not sure about Medicina, but I am sure they're going to match it.
These grants would be the first ones under the recently adopted contract terms, right? Or that's not right. That's
not actually true. We will be applying the contract terms that were approved at the January 20th meeting to 6 companies in advance of these. The first 2 of those companies were actually approved at the February meeting in 2014. That's ProPep Surgical and BetaCat. There were 4 additional companies that were approved, I believe, at the May 2014 meeting, and that is that would be Ares, Myrna, Curtana, and OncoNanomed. So those 6 companies will also be offered those terms, as well as these following 4 and all those to come, as a matter of fact.
How's the reception in the marketplace to those terms?
I have sent those terms now around to the 6 companies that would be subject to the contract terms. I have received emails from, I think, 4 of the 6, and they're positive. They want to move forward.
Thank you.
They'd like free money.
Oh, they definitely like the terms to be softer, without a doubt. And I mean, if I were sitting on their side of the table, of course, I would want the same thing too.
Is it good if they say yes quickly, or is it better if they say no, we can't do that? I'm just kidding.
Well, I think they understand that these are the terms that they better like.
Other questions or comments?
And I guess by saying that, you're also saying that they are not so onerous that will chase everybody away.
Oh, I don't think they're that.
Okay.
I do not think that they're that.
If we started getting indications of that, we would get back to you, because that clearly is not our purpose.
Right. Thank you.
We want a fair return, though.
Okay. I believe now we're ready for Mr. Reisman to come up and give us our Chief Compliance Officer's report for that slate that's before us.
Good afternoon, Chair Rice and members. My name is David Reisman. I'm the Chief Compliance Officer. It's on. I have reviewed the compliance pedigrees for the grant applications for product development awards. I have conferred with staff at CPRIT and SRA International and studied the supporting grant review documentation, including third-party observer reports for the peer review meetings. I'm satisfied that the application review process that resulted in the 4 applications for the new company award slate recommended by the Chief Executive Officer followed applicable laws and agency administrative rules. I hereby certify this award slate for the Oversight Committee's consideration. Thank you.
Thank you. So again, members, the process here is we're going to approve the PIC recommendations through a motion in a minute. We're going to approve, or I will have a motion in a moment for delegation of authority for the contracting, and then we'll have a third motion to authorize what is called advance payments to companies, which is one of the ways they can be funded in the very, very early moments of the grant before they have met milestones or before those apply. So let me just, so the Program Integration Committee has recommended 4 new company applications for product development awards. We'll take them up as a group. We'll ask for the awards and the awards amounts as listed on page 27 of the packet at your seats, which we've been reviewing. So at this time, we'll take a motion to approve each of the PIC's recommendations for new company product development research awards. And I'm looking for a motion there.
So moved.
Is there a second? Second. All in favor, say aye.
Aye.
Any opposed? Motion carries. Thank you. So we'll next take a motion for the new company development awards. Is there a motion to delegate the contract negotiation authority to the CEO and CPRIT staff and to authorize the CEO to sign contracts on behalf of the Institute? Looking for that motion.
So moved.
Is there a second? Thank you. Any all in favor?
Aye.
Any opposed? Motion carries. Thank you. Thank you. Yes, there were no conflicts of interest reported there, so we want that on the record. Now, members, Mr. Roberts has notified the board by letter provided to the Oversight Committee on February 10th, indicating that he seeks authority to disperse grant funds in advance to the 4 companies that we just approved. Are there any questions for Mr. Roberts in this regard?
Now that he's been through contract training, no.
Great point. So, and again, this is usual and customary for product development awards, and so we're looking for a motion, please, I guess pursuant to General Appropriations Act, Article 9, Section 4.03, do I have a motion to authorize CPRIT to disperse grant funds via advance payments to the 4 product development awards we just approved?
So moved.
Is there a second? Second. All in favor, say aye, please.
Aye.
Any opposed? Motion carries. Thank you.
Thank you, members.
Thank you.
Thank you. So at this time, I'm going to take over for a moment and recognize, I guess, myself to talk about the Nominations Committee. The Nominations Committee met on the 13th, and the Chief Executive Officer to discuss the Chief Executive Officer's new appointments to the Scientific Research and Prevention Programs Committee. The Nominations Committee recommends approval of the 3 appointments to this CPRIT's Scientific Research and Prevention Programs. Any discussion? Hearing none, would like for a motion to approve the CEO's appointment to the Scientific Research and Prevention Committee. Is there a motion?
So moved.
Is there a second? Second. All in favor, say aye.
Aye.
Any opposed? Motion carries. Thank you. So we'll keep going now on to item 14, tab 11, and we're going to have the Advisory Committee on Childhood Cancers discussion. CPRIT's administrative rules require Advisory Committee to report to the Oversight Committee at least annually regarding the activities of the Advisory Committee. At this time, the Chair will recognize Dr. Gail Tomlinson to give a presentation to the Oversight Committee on behalf of the Advisory Committee on Childhood Cancers. Dr. Tomlinson serves as Chair of the committee and is a practicing pediatric oncologist at the University of Texas Health Science Center in San Antonio, where she also serves as the Interim Director of the Greenhays Children's Cancer Research Institute, and she is also a CPRIT grant recipient. So, Dr. Tomlinson, thank you very much for being here today. We look forward to hearing from you.
Okay, well, thank you, Dr. Rice, and members of the Oversight Committee for allowing me to give this report about the Advisory Committee on Childhood Cancer. I know you've heard a lot about childhood cancer from this morning from Dr. Kripke and from Annette Leslie, so I'll try to be rather brief. Just to update you on our committee composition, we have 10 members of this committee currently. 7 are pediatric oncologists, all involved in research and all involved in active patient care. One of our oncologists is in private practice. We also have 1 pure laboratory scientist who has a strong interest in pediatric cancer, and 2 patient parent advocates. The academic institutions represented, I think, are broad and represent institutions in Houston, Dallas, San Antonio, and Lubbock. And these are the names of our current members, and they're in your handouts, and you'll recognize some of them, I'm sure. We have had discussion on our conference calls and meetings about evaluating membership guidelines and exactly who do we want and what kind of background do we need on this committee. Clearly, we need individuals with research background given the nature of CPRIT. We also feel like having advocates for patients on this committee is very, very important. We've also discussed establishing guidelines for membership turnover because we all agree that turnover is good, and we are accepting nominations for new members. I think our philosophy is we want to be more inclusive than exclusive, and we welcome members who have a strong interest in cancer and the goals of CPRIT. We also, of course, want geographic and institutional diversity and just a diverse group in general to provide input into the discussions. So since the moratorium, we were reconvened in the summer of 2014. We had an in-person meeting in Austin, September of 2014. Soon after, we constructed a white paper, and this was presented by one of my colleagues, Dr. Pat Reynolds, at the Oversight Committee in the fall of 2014, and I know there was considerable discussion, and I'm just going to briefly highlight on some of the outcomes and updates on some of our recommendations. We also had a conference call recently in February of this year. The white paper recommendations plus the substance of my talk today will comprise a required annual report from our committee. Just as an aside, here's a couple blurry pictures from my iPhone that were taken in Washington, D.C. in September. This is Childhood Cancer Awareness Month. And although not officially part of the ACCC, the committee had good representation. This is a picture of Annette Leslie and Tim Culliver at a reception honoring Representative McCall from here in Austin, who is one of the authors of the Concord Children's Cancer Act. There were a lot of activities that week on Capitol Hill, on the White House. This particular event was also attended by Mr. Wayne Roberts from CPRIT and also Dr. Greg Awney, who spoke at one of these meetings earlier this year, who actually went to the White House afterwards for an invited presentation. So it was a day that I think Texas was well represented. CPRIT was there indirectly, and I was certainly proud to be from Texas that day. So just getting back to the substance, this is from a recent journal article reviewed by two of my colleagues from St. Jude's, and it just has a couple important statistics. On the left, you see that childhood cancer, defined as cancer under the age of 20, represents 1% of all cancers. So we are clearly a minority in terms of the patients we treat and the types of tumors we treat. As a group, though, there's been a lot of progress in childhood cancer, and you can see the survivorship has gone up dramatically from 1975 to 2005. We roughly say that about 75 to 80% of childhood cancer survivors, children with cancer become long-term survivors. With survivorship, there is a cost, and for every child that we treat that becomes a survivor, we have many years, if not decades, to deal with the effects of childhood cancer treatment and the long-range side effects. So a lot of the efforts in going into finding new treatment methods are aimed not just at killing the cancer cells, but also minimizing side effects as well. At one of our earlier conferences calls this week, we really talked a lot about what the disease priorities, and even though in a lot of diseases, there's been a lot of progress and cure rates have gone up. There still are some diseases where we're not very good at providing cure. Brain tumors is probably at the top of the list. Also, certain bone tumors, particularly Ewing sarcoma, especially when they're metastatic. Acute myeloid leukemia is difficult to treat in both children and adults. ALL, or acute lymphoblastic leukemia, this is the most common cancer in childhood, and we brag about the cure rates a lot because they've gone up from 20% several decades ago to close to 90% or even better in some of the risk groups. But still, up to 20% of children with ALL relapse, and there still needs to be a lot of work done in relapsed ALL. And it's a rapidly moving field with the new advances in immunotherapy, but it's still, I think, a priority for future research. High-risk neuroblastoma is very difficult to sustain long-term cures, and really other relapsed solid tumors as well. So those are our disease priorities. And I was actually looking through the titles of the grants funded today, and we were pleased to see we saw several in brain tumors, one in Ewing's, and several in ALL, including relapsed ALL. So we are hitting our disease priorities. So that's good. We have made some recommendations. We're very pleased with the specialized RFA for childhood and cancer research. This has been a success. You've seen the statistics, and we're very glad to hear that this is going to continue, and there'll be a similar RFA issued later this spring. We think there needs to be an emphasis on multi-investigator and multi-institutional projects because children's cancers are rare, and it works best when investigators work together. I think there are opportunities within the existing CPRIT structure for this, and the onus is on us as researchers and investigators at different institutions to get people together to write some of these projects and submit them for funding. We do feel like we need additional recruitments. There have been lots of great recruits, probably not as many as we'd like in childhood cancer, and that's something we don't have a lot of control over, but it's something to keep in mind. A recommendation that I believe has been discussed on our calls, and I believe has been brought forward and had some discussion, is that there are certain limitations when universities are allowed to only submit one core grant in response to an RFA for a research core. A lot of the big cancer centers, they may love the pediatric oncologists and what they do, but when there are so many other competing interests with large groups of disease-specific projects involve many investigators from one institution, there's less likely to be enthusiasm for a pediatric project involving a research core. So the recommendation has been made that perhaps there could be exception to the one core per institution if the second one was focused on pediatrics. And this could bring in multiple institutions as well.
Dr. Tomlinson, Let me just interrupt for a second. Dr. Kripke, I believe we've discussed that in the Scientific Research Subcommittee. Have we adopted that, or is that still in process? Or I don't know where that is, but that maps right directly to that point. And we can do that offline. We've definitely brought that up and talked about it. The cycle, okay. Okay, thank you. So we've intended to adopt that. Till the cores come up again. Okay, excuse me for interrupting, but I believe I just wanted to let you know we've addressed that, or at least plan to.
That's good. That's good. That's very good to hear. Thank you. Another recommendation is we feel like we need a clinical trials infrastructure because of the rarity of childhood cancer. No one institution, with very rare exceptions, can really do a clinical trial at their own institution. We do work with the National Cooperative Group, Children's Oncology Group. We all work with them, and we'll continue to work with them, but often the timeline is very long in developing trials, and often they require preliminary data or preliminary evidence that a certain treatment regimen is working. This is something that possibly could come under the research cores, the establishment of a multi-institutional clinical trials. I don't think, as a group, we have any real structure or ideas in place on how to run this, but we think it's something that's very badly needed because we need to be able to translate some of the research findings. Some of the research findings coming out of CPRIT-funded grants, we need to be able to translate them into clinical care. So that's something we want to work on, and we want CPRIT to know we want to work on that. But again, I think the onus is on the investigators and the clinicians in Texas to get some good proposals together. So we'll be working on that. Also, we talked about the annual meetings on the last conference call, and we'd like to talk about this some more on the next conference call. While you folks were in your closed session, we did some talking out here in the peanut gallery, and we did come up with some ideas for maybe having a part day, maybe a childhood cancer track with a networking center and maybe designated tables at the lunch area with everybody else, but designated tables that people who wanted to work on childhood cancer could meet, and then maybe a research session in the afternoon, something along those lines. So we've already had some discussion, and I think that sounds very doable, so we'd like to see that. And we'll go back to our other committee members and get some more input from them as well. And then I had a couple recommendations for peer review, and this was more of a discussion we had. The observation was made that some of the grants that were deemed highly meritorious were limited by funds available. And just listening today, I hear that you're very cognizant of this, have had some very extensive discussions, and are well aware of the fact. I'm only bringing it up because we spent quite a bit of time on our call, and it was brought up that if a grant isn't funded, the opportunity is there to put it back in the next year, but a lot of research ideas are very fresh and innovative. They lose some of their sparkle over a year's time. In addition, there are projects that are very, very timely. Something is really ready to go to the next step. And in subsequent discussion, it was just brought out if there could be any mechanism for providing some partial funding or some pilot funding if something was really meritorious, rather than waiting a full cycle. And I can understand how you've had quite a bit of discussion among your committee and with the CPRIT leadership. So I will just plant that idea because it did come up on our calls. And I realize that this is throughout all the RFAs. I think we had 2 in pediatrics, and there were a total of 10 or 11 that were in this category. So we did have quite a bit of discussion about that. And then the other peer review, just continuing to ensure that adequate expertise in pediatric cancer is within all the review teams. We don't have a pediatric review panel, and there's good justification for not doing that we've talked about, because a cancer biology grant needs to be reviewed by cancer biology. Cancer genetics needs to be reviewed by somebody who knows genetics. Same with immunology. 2 of the review committees actually have people at their head that have experience in pediatric cancer, but we just want to make sure that there's adequate expertise in pediatric cancer within all the review teams, and this could require sometimes bringing in a extra ad hoc reviewer. So just, we've talked about research, realizing CPRIT is also about prevention and commercialization. As far as prevention, the historical thinking is that prevention is not possible for most childhood cancers. Most childhood cancers occur in children who are previously healthy. They seem to come out of the blue, so to speak. I use the word historical because it's possible that someday we could be able to prevent cancer. This would come under prevention research. But unfortunately for right now, we don't have an intervention or a service we can provide to prevent childhood cancer. Early detection is probably possible for a minority, but not the minority of childhood cancers. Tertiary prevention, though, defined as survivorship and minimization of side effects, is a huge area because these children receive very intensive chemotherapy, and there's even when we are successful in curing, there are side effects that occur 10, 20, 30, 40 years later. So we are creating a whole new health issue by curing childhood cancer, and services in this area can be adequately addressed in the prevention program. And I think there are some good prevention proposals that have been funded, and this should remain to be a priority. And then lastly, industry and childhood cancer. Childhood cancers are orphan diseases, and no company is going to make their billions of dollars in developing a drug specifically for a pediatric disease. But there are ways that perhaps pediatrics could be brought into the commercialization field. In the federal legislation, there are some vouchers that have been brought about and through Congress and through advocacy, in which industries are incentivized to provide drugs or develop drugs for pediatric cancers. In addition, there could be incentives that just would perhaps increase funding by a small incremental margin that would include some pediatric cell lines or animal models or what have you in the testing of new drugs. And so I think there are some ways that the commercialization and development, even if not specifically focused on pediatric disease, could address or include some aspects that would benefit children with cancer. So what's our success rate in childhood cancer research through CPRIT? It's actually pretty good. Dr. Kripke quoted the statistics and the research funding slate as well. Previously, in the previous cycle, I have 2% indicated pediatric focus by self-report. I think the amount you report today was a little bit higher. And in previous CPRIT cycles, it's really hard to put an accurate number on this because this is all by self-report, and in the early few cycles, they didn't have self-report on the applications. The early MIRAs that were in disease-specific areas, in the first round, there were 2 that were specifically on childhood cancer, and then in a subsequent round, there was a third. And so I think in the multi-investigator research award area, childhood cancer has done well. And in the recent RFA, which Dr. Kripke already presented to you, out of 56 applications, there was a 17.9 success rate in pediatrics. These are the ones that are actually being funded as of today, and a whopping almost 20% of the overall awards in pediatric cancer. And I just heard the last statistics that over 30% of the dollars in this round went to childhood cancer. That's really phenomenal, and we are very optimistic that good things will continue to come. Lastly, I just wanted you to know on behalf of our committee, there really was expressed quite a lot of gratitude for, number one, for the legislation and letting us have a voice for children with cancer, and to the CPRIT leadership for listening to us and helping CPRIT be creative in finding ways to advance childhood cancer research. So I'll stop there and take any questions.
Thank you very much, Dr. Tomlinson, for that great report.
Sure, thank you.
Other questions or comments or thoughts? Please.
Mm-hmm.
Questions about the smart living
Mm-hmm. 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 Yes.
Are these listed in
No, not really. It's pretty much a random sequence. I mean, brain tumors is always quoted as, although the cure rates are getting better, but they're still not above the 50% cure rate in most types, infant brain tumors. But as far as this slide, I really put them in random sequence. They're probably the ones I took on my notes on the conference call that people brought up. So, but brain tumors is always at the top.
And if you prioritize these amongst the top 2, what would you?
I think brain tumors, and I think acute myeloid leukemia is and I mean Ewing's is up there too. But I think those are the ones. There's been a lot of very interesting work in the last year on relapsed ALL and immunotherapy, and it's just all coming out now. And I think that's a very exciting field. And hopefully, in a few years, we can take that off the list. So. Mm-hmm, mm-hmm. I don't think I can answer that. The statutes of liberty of limitations for any pediatric endeavor are longer than they are in adults, but I don't know about that specific piece of legislation. I know. I think the until a child reaches adulthood. I mean, that's just in the malpractice world, but I'm not really familiar with that. I don't know if I would need some help from the legal community on that, so. I don't think that's the barrier. I think the barrier is the number of children that the drugs would eventually reach and the feasibility of doing pediatric trials. You have to do them through a national network or a large regional network, but I don't think it's a liability. And the new drugs are usually tried first in, of course, phase 1, and these are in children. They're children and parents that are desperate for new treatments and are willing to accept at least short-term toxicity. I don't think that's a limiting factor from the industry standpoint. I think they would. I mean, I think we'd like to learn more about that, and I just don't know the details. But I think it's if that's perceived as an obstacle, that's clearly worth pursuing as far as discussion. Sure. Thank you for your questions.
Other questions, comments? Thank you again, Dr. Tomlinson. We're going to proceed to item 14 then on the agenda, which should be the item 15 on the and talk from the get an update from the University Advisory Committee. Sorry. So the chair recognizes Mary Ann Ottinger to present the. I'm sorry. We're on item 15, tab 12. Apologize. So we're going to recognize Dr. Mary Ann Ottinger to present the University Advisory Committee's annual report to this Oversight Committee. Dr. Ottinger serves as vice chair of the committee and works at the University of Houston System as the Associate Vice Chancellor for Research, where she oversees the Office of Research Development. Welcome.
Thank you very much. This is on, right? Okay. Yeah. I also would like to echo my colleagues' appreciation of all that CPRIT has been doing, as well as allowing us to have a University Advisory Committee where we can give you our recommendations for your consideration and be able to be part of the process. So as you know, the University Advisory Committee has the function to advise the Oversight Committee, and each of the research and prevention program peer review committees regarding the role of institutions of higher ed. Our advisory committee is made up of 9 members. The chair is Cheryl Walker from the IBT of Texas A&M. Mike Jacobson from Pharmacy, University of North Texas Health Science Center. Vicki Colvin, Vice Provost for Research at Rice University. Billy Covington from Associate Vice President for Research and Federal Relations at Texas State University. Kent Osborne, who's Director of the Dan L. Duncan Cancer Center at Baylor College of Medicine. Myself at the University of Houston. Ian Thompson, Director of the Cancer Therapy and Research Center, University of Texas Health Science Center at San Antonio, and Michael Kahn from Texas Tech. So together, we've taken under advisement a number of different issues. We've developed a white paper that I know you've already seen, and what I'm going to do today is just briefly go over high points and be available to answer any questions. I know the day is going on and it's getting late, so my report will be quite brief, and I'll be glad to answer questions. In our white paper, we considered the spectrum of activities that CPRIT has been undertaking. And what we had endeavored to do was to highlight those things that we felt have been very successful and of great benefit, not only to the research endeavors of our faculty members and the research community, but also areas that we feel need to be really enhanced and have been especially successful in moving the fields forward and moving the discoveries forward. So we convened in April, again in June, and then by phone in July, and just a few weeks ago again. So the committee's been very active. We've taken a broad look at the types of awards within the research and prevention portfolios and considered the entire spectrum, including investigator-initiated early product development and recruitment awards. We also looked at existing mechanisms of support and new funding mechanisms that we would want you all to consider. In terms of current strengths within the CPRIT portfolio, bless you, the investigator-initiated awards are really powerful. They afford the opportunity for investigators to pursue very solid individual research programs. They're really the cornerstone of a lot of the groundbreaking research progress. And they've been highly utilized and very successful, with many outcomes that have been very, very noteworthy. As such, the UAC would strongly recommend that this be continued. Recruitment awards have been arguably one of the best and most successful of the programs. I know at the University of Houston, we've greatly appreciated it, and I know other institutions have as well. It allows us to recruit really extraordinary scientists at various levels of their career, and it allows us to have the way to incentivize many of these folks to come to Texas, to our institutions where maybe we would not have had the wherewithal to do so. So we've been able to recruit the best and the brightest using this mechanism. As such, we would really like for this to remain a high priority. In terms of new initiatives, one of the areas that we would ask you to consider is that of cancers that disproportionately affect Texans. That includes many kinds of cancers. You've already heard about lung cancer today, and of course there's the issues of obesity and diabetes, which then intersect with various forms of cancer. There are geographic, ethnic, environmental, and other factors that influence the rate of cancer and the distribution of cancers. Health disparities is obviously a major consideration, and one that I'll mention a little bit more later. But it's clear that these factors affect the incidence, the rate, and the occurrence of cancers, and potentially the success for treatment. Our recommendation would be that CPRIT take into consideration the development of some new scientific initiatives, and that some of these address cancers that are disproportionately affecting citizens in the state of Texas. Another area that we would ask for you to consider is that of cooperative centers and regional and statewide infrastructure networks. We all the universities suffer from the fact that the technologies are gaining speed. They're advancing very, very rapidly, and it's impossible for any one institution to cover everything. Science is obviously getting more and more multidisciplinary, more and more collaborative, and that's the only way we can go in order to really stay at the cutting edge. Because of that, there are models already out there, such as the New York Genome Center, that utilizes sort of a model to gather the experts together, to have them collaborative. And these networks can be virtual, they can be in the same city, they can be within an institution, they can have many different forms. But generally, they're extraordinarily successful. So our recommendation is that CPRIT develop a mechanism or mechanisms to foster these types of relationships. This would provide both regional and statewide access to many kinds of innovative technologies and instrumentation, and it would accelerate our capabilities in addressing many very specific kinds of technological and research needs. Another area would be increased investment in disciplines aligned with computational biology. I know you've already considered this, and we're very grateful for that because we feel this is an extraordinarily important area. It allows us to take advantage of very, very large data sets to begin to not only model but understand the factors and look at them over time or over age or, over many different factors. So these kinds of collaborative, multidisciplinary efforts with the capability of using computational biology as an underpinning would provide us great capabilities. So obviously, our recommendation is that, and to make an appeal for that to be considered. Another area that we considered has to do with preclinical and clinical trials research. Again, translation of fundamental research into applications is a critical area, and that's already been discussed during this meeting. So we would advocate for that and recommend that this be fostered. Finally, a focus on product development, especially for new instrumentation and technologies, would be very helpful because it allows us to move drugs and devices into the clinic more efficiently, and it allows the academic research community to have access to many of these capabilities as well. So our recommendation there would be investments in technology with the potential to equally impact both the commercial and academic research sectors would be extremely helpful. I'll be glad to take any questions.
Thank you very much for that great report. Any questions for Dr. Ottinger?
Thank you. Quick questions. As you know, CPRIT has provided many millions of dollars for research.
Right.
And I'm wondering, what's the metrics to know whether that research was well spent? For instance,
right.
Could it be, the metric be how many science or nature publications come out of the research? Could it be how many follow-on grants, whether it's R1 or X grants? I'm just wondering, here's the money we put into the university system.
Right.
How do we know if our dollars were well spent?
So I'm going to give you two answers. One's going to be from myself personally. At the national level, I've been very involved in a National Academies of Science group called Federal Demonstration Partnership. That entity is a blend of agencies and universities. And one of the initiatives they've taken on is something called STAR metrics. And the reason they took it on was explicitly that need. I know the NIH, the NSF, all the agencies struggle with how do we actually figure out what we got out of the money that we put in. And so everybody's trying to get their hands around this particular issue. The STAR metrics approach, what they've settled on, just as an example, they settled on publications, but they also settled on IP, as well as patents, as well as deliverables. So they're trying to look at the entire end-to-end, if you will, of basic research now translating into products that now do something for the public, that the public sees. Some of these things are not easily equated in terms of dollars to exact outcomes. But in some of the calculations that they've made in terms of the benefit to the public, it's been 700, 900,000, and don't quote me on that, please, times return. So that particular approach where you look at it as far as what kind of benefit, be it fewer people hospitalized, be it shorter, stays and, better health, fewer people getting sick, whatever metric shows a great return. In terms of the what I have seen here in Texas with the benefit from the CPRIT program, I see many, many benefits. I don't have the data at hand, and I would refer to Dr. Kripke for specifics, but I've seen a lot of, and I'm fairly new to Texas, so I've seen a lot of very vibrant, fast-moving programs that I don't believe would have occurred without CPRIT support. I see many people collaborating and making advances that I don't think would have happened. And yes, you can certainly count the papers.
But not just papers. I'm talking about papers in top journals. But
right.
So do you think the University Advisory Committee could propose some metrics so we could
certainly
so we could have a way to see how our money is being spent? And the other, because I don't want to go on too long, but in your list of what CPRIT funding should be, you mentioned a number of good ideas: genome projects, computational biology, things like that. And kind of when I look at that, I think these are things that there's many places that do computational biology. There's many places that have genome projects.
Right.
And I'm just wondering, welcome to Texas, by the way.
Oh, thank you.
But as Texans, we like to stride a little bit longer. And is there something that the university committee could propose that would be new, unique, and different, and a Texas idea that would just blow everybody away, where we're just not replicating things that are done other places?
So again, speaking as someone new, and I'm not all that, like a year and a half, but so I came from the DC area. I like it. Anyway, but what I would say is that some of the initiatives that are being proposed here are, and again, speaking as from myself, are very apropos for Texas. For example, and they may be problems that are other places, but the obesity problem and the intersection with aging and with disease, with cancer. Those kinds of things are huge problems, and especially with the health disparities, the diversity of our population, the diverse needs in the population in Texas. So the answer is yes. I'll take it back to the University Advisory Committee, but I already see some areas that would be very, very apropos. Okay. Good. Excellent. Thank you.
Other questions, please?
Yeah. Thank you for your testimony, Dr. Ottinger. One of your recommendations is really an endorsement of our part of the work that the Oversight Committee did earlier in the year, and that's focus on cancers that disproportionately impact Texans, looking at geographic, ethnic, and environmental. And we look forward to working with the university community to advance that shared mission. We talked earlier in the day about using these areas of emphasis to also influence recruiting RFPs. And Dr. Tomlinson talked about how she thought it would be valuable to use that in trying to recruit pediatric researchers to Texas. What are your thoughts about also recruiting that would align with these areas of emphasis that you have laid out for us, or that we have laid out for ourselves?
I think it could be a very useful way to attract folks in particular areas. The only reason I would hesitate is I'd like to go back to the University Advisory Committee and find out a little bit more about the hiring practices in the various universities. Because as you all know, normally there are somewhat prescribed areas in which people are hiring, and then there's the aspect of who are the most qualified people you get in, and so it might move away from some of those areas a little bit. So I'd want to see what the population of candidates would look like and where the university's strategic plans are are going, I think it could be a very good thing, especially if there was a possibility of resources to help establish that area or to enhance that area in that university. But I would like to hear my colleagues' input.
Well, thank you. We look forward to getting that input from you and your colleagues. Thanks very much.
Other comments or questions? Thank you again, Dr. Ottinger, for coming today, and Dr. Tomlinson as well, for both of you traveling to be with us today. And we appreciate your reports and your comments, and we look forward to the ongoing conversation.
Thank you.
Thank you all. We're going to proceed with item 16 on the agenda, the CEO report relating to the Health and Safety Code requirements, 102.260. And at this time, the Chair is going to recognize Mr. Roberts to report on the merit and progress of the CPRIT's 3 programs. I'm sorry, item 16, tab 13.
Yes, members, behind tab 13 is a memo concerning my assessment of the progress and merits of CPRIT's Academic Research Prevention Program and Product Development Research Program for fiscal year 2014. In summary, I believe the CPRIT program showed progress and merit in FY 2014. In addition to the information provided in the annual report, which you were provided a hard copy of earlier today, I provide this overview that lists some of the accomplishments that help illustrate program process for each program. No action is necessary on your part, and out of respect of time, I think that my report justifies the programs and that we need to keep on going on in the directions that you've specified.
Thank you. Any questions or comments?
Real quickly, it's too early for this report to include our progress against the areas of emphasis, but when you make this report next year,
yes,
would you make sure?
This is an initial iteration of that, and actually the future reports we intend to put into this hard document, and the metrics documenting progress in your program priorities is going to be a very important part moving forward.
Thank you.
And I've got to say this again. We've been out among across the state, and the program priorities have received quite a lot of positive feedback. I meet next week with a group down at the medical center where we're going to be discussing them, but I think I knew those program priorities were going to be important, but I'm now just beginning to see how significant they are, and you will hear them being used and documented going forward.
Any other questions or comments? Thank you. So we'll move on to item 17, which is under tab 14. We'll recognize Ms. McConnell to present the staff recommendation for grant compliance monitoring procurement. Ms. McConnell is going to manage, I think, items 17, 18, and 19 at this time on the agenda, kind of in sequence. And this will be an exercise to confirm that we don't have conflicts of interest or financial interests, and then we'll be approving each of these. Ed.
Thank you. So under tab 14 is the staff's recommendation to move forward with a grant compliance monitoring contract with Cone Resnick for a not to exceed amount of $336,000. This would be for the remainder of fiscal year 2015, so approximately 6 months. We believe that Cone Resnick presents the best value for this contract because the company has extensive experience with grant compliance monitoring in Texas and in other states, and that includes monitoring of scientific grants, and they have a strong customer service approach. The advisory team that would work on the CPRIT engagement includes a former Inspector General of the Department of Housing and Urban Development, as well as a former Auditor General of the U.S. Department of Navy. And the company presented the lowest cost option among the 3 proposals and has provided us with a certification that they would contract 24% of their monitoring work to a certified public accounting firm in Texas with a hub designation. And so related to the earlier conversation about the requirements that we have to make efforts to increase our hub procurement, this would be one way to do it. Provided that the Oversight Committee has no conflicts of interest with the recommended vendor, we recommend moving forward with this request to contract with them. This will require approval by the Legislative Budget Board related to the contract limitations in the General Appropriations Act. If there are any questions, I'll move forward with the other items.
Do we want to move through the conflict and then motions one at a time?
Yeah, let's do that.
Okay. Sorry, let us just do one at a time. So
Okay.
any questions on this contract, which is for the grant compliance monitoring at this time? So the audit committee met on February 9th and discussed the staff recommendation, and the audit committee recommends that the oversight committee authorize the agency to move forward with this contract with Cohn-Resnick to provide these services. And as we've discussed earlier today, I guess Senate Bill 353, which prohibits CPRIT from contracting with any entity that where an oversight committee or family member has a financial interest. We want to just sort of go through this process. So the question right now is, well, it's our understanding that we were all contacted before the meeting and that no one has any conflicts of interest. And the general counsel informs me that nothing was reported. Let's just confirm at this time, does anybody have any financial conflicts of interest with this firm, Cohn-Resnick? Seeing none, hearing none, then we'll take a motion to authorize the agency to seek approval for a contract with Cohn-Resnick to provide grant compliance monitoring services not to exceed, in an amount not to exceed $336,000. Is there a motion? Thank you. Second? All in favor?
Aye.
Any opposed? Motion carries. Thank you. So now let's move to item 18, tab 15, and it'll be presentation of the internal audit services contract.
So the staff recommendation for the internal audit services contract for FY15 is to procure services with Weaver and Tidwell for a not to exceed amount of $217,500. Weaver and Tidwell presents the best value because it has extensive experience as an outsourced or co-sourced internal auditor for several Texas state agencies. And it also provided a strategic recommendation to amend our current internal audit plan and reduce hours for or eliminating all of the 10 grantee audits and potentially reallocating some of those hours to agency operational audits or reducing them altogether. The reason that they made this recommendation is because concurrently we are also moving forward with our grant compliance monitoring, and they believe that is redundant. So we would be basically hitting the same grantees through an audit or compliance monitoring. One thing I do want to note is that one of the vendors that submitted a proposal is our incumbent internal auditor, Grant Thornton. They did provide a lower priced amount on their proposal, but we do believe that because they have provided internal audit services to the agency for the past 5 years since fiscal year 2009, that it's an appropriate time to change vendors and kind of have a fresh look of our services, and we believe this would be a best practice. So that's our recommendation.
Any questions or comments, please? Can you tell us in a very general term, we've gone for something that's not the lowest bidder for the reasons you described, best practice. Was the difference there a large amount or medium amount or small amount?
Best value.
What's that?
Best value.
Best value.
Initially, the difference, and there were 3 vendors, so initially another vendor, not Grant Thornton, was the lowest bidder. The difference on those initial bids was about $29,000. Actually, after the staff and subsequent to my writing this memo, we did receive updated bids from vendors because we had completed our oral presentations, and we asked them to submit any changes. And that increased a little bit, that difference. It's probably about $50,000 now.
Okay.
But we still believe that changing vendors at this time to provide our internal audit services would be a best practice. And because of this is a not to exceed amount. Obviously, especially taking out internal audits of grantees, the actual cost that we would incur would come down because we only pay for the hours of services that are needed.
Gotcha. Thank you. Again, any questions otherwise? So again, as we said, the audit committee met on February 9th and reviewed this and recommends that we move forward with the contract with Weaver and Tidwell. And General Counsel has informed me that there's no financial conflicts of interest with the contract with Weaver Tidwell, but we want to just confirm it now that there are no financial conflicts of interest. Anybody? Seeing none, we'll move ahead with the motion. So we'd like a motion to authorize the agency to seek approval for a contract with Weaver and Tidwell to provide internal audit services not to exceed $217,500. Is there a motion?
So moved.
Thank you. Second. All in favor, say aye.
Aye.
Any opposed? Motion carries. Thank you. So now we'll go to item 19, and we'll discuss the SRA International contract renewal option.
So I also bring forward a staff recommendation that the agency make preparations to move forward with exercising the 12-month renewal option for FY 2016 with SRA International for our pre- and post-award grants management support services. We have to prepare all of the initial grant award cycles. I think, as you heard the program chiefs talk earlier today, they're preparing their RFAs right now for awards that would actually be considered in the fall of 2016. And so for us to really make those preparations, we need to develop a full statement of work and determination of all of the grant cycles that we are going to have in FY16 to have a vendor, and currently SRA, provide us with pricing on that. We would obviously bring all of that back to you, but we do want, because of the amount of this contract, $11.5 million, to receive authorization to move forward with that process. And in the meantime, we will also be developing a statement of work for a full-blown request for proposal for these same services for 2017 and beyond, recognizing that we will probably have to have about a 6-month transition period in 2016 if we do have to switch vendors, just because of the extent of the programs and the time frame involved with preparations.
Gotcha. Thank you. Any questions or comments?
How much would it cost to change? Any idea at all?
I have no idea until we
go through a whole process.
Yeah.
And you'll obviously will be doing that before the middle of 2016, obviously.
Correct.
And so we'll hear more about that as we go. So again, as we've said, the audit subcommittee met and reviewed this request and recommends that the oversight committee approve it. General Counsel has informed me that no financial interests in the contract with SRA were reported by oversight committees, but we want to affirm that once again for all those that are here. Any conflicts in this regard? No. Hearing none, so we'll look for motion to approve the Chief Executive Officer exercising the renewal option to extend the SRA International contract for the fiscal year 2016. May I have a motion?
So moved.
Is there a second? Second. All in favor, say aye.
Aye.
Any opposed? Motion carries. Thank you. So we're going to move now to, thank you very much, Ms. McConnell. We're going to move now to items 20 and 21, and our counsel, Kristen Doyle, will talk to us.
So, members, you remember from past meetings, the rulemaking process in Texas is essentially a two-step process. First, we bring the preliminary rules to the Oversight Committee for approval for publication. Those are published on our website and in the Texas Register. And we seek public comments. Once we have the public comment period has expired, we can bring back the rule and any comments and changes that were recommended by the comments to the Oversight Committee for final approval. So the first item, so item 20, which is behind tab 17, is the second stage of the process. It's the adoption of the final rules. There were changes to two different rules. One was 7036. It was authorizing the chief compliance officer to serve the same role for the peer review panels that the compliance officer serves for the PIC, where they can observe and provide a report in terms of the compliance with our rules and processes for peer review. So, that CPRIT staff that attended did not participate in the discussion, deliberation, or vote, that people who had declared conflicts of interest signed out and left the room or left the call when it was discussed, those sorts of things. The other rule change was to Rule 70311, which is the matching funds rule, and provide additional clarity. If you recall, during the last legislative session, significant changes were made to the matching funds rule for academic research institutions. They are able to use their federal indirect cost rate essentially as a credit toward the matching funds. And so over the past year and a half, we've provided additional clarity for those universities that are using their federal indirect cost rate. We received public comment on both of the rules that I talked about from MD Anderson. They were the only entity that provided public comment. For the rule change to 7036, they actually commented on a different section of 7036. So it's not germane to the rulemaking. I've informed MD Anderson of the process for rulemaking comments. If they want to initiate a rule change, we have a process for that. I haven't heard anything back from them, but we're not making a change to 7036. In terms of 70311, they didn't recommend a change so much as they asked for clarification for an example of how the rule change would be used. So you'll see in the final order that's provided for you behind tab 17 that an example is provided for them, and then also it reflects the comments that they were made.
Thank you. Any questions, comments? So we'll note that there's a memo from the Board Governance Subcommittee in the packet recommending approval of these changes, and if there are no other questions, we'll move for a motion to approve the final orders adopting CPRIT's rule changes and direct staff to file the orders with the Secretary of State. Is there a motion?
So moved.
Second? Thank you. All in favor say aye.
Aye.
Any opposed? Motion carries. So now item 21, which is additional administrative rule changes.
So this is the first step of the process. These are proposed rules, approval by the Oversight Committee of these proposed rules will start the rulemaking process. We'll publish in the Texas Register, make it available on our website. This, again, is another change to the matching funds rule. It provides additional clarity particularly for academic institutions. Like I said before, they're able to use their federal indirect cost rate as the matching funds credit. However, for some universities, that indirect cost rate is not enough to fulfill the entirety of their credit, and so they have to do a hard dollar match, essentially. So this helps give some guidance in terms of what we consider to be funds dedicated toward the project. So we'll put this out for publication. We perhaps may receive comments on it. I'll bring those comments and any proposed changes to this rule first to the Board Governance Subcommittee and then hopefully to the Oversight Committee in May.
Thank you. Any questions, comments? So as before, again, the Board Governance Subcommittee has recommended approval of these proposed changes, and if there are no other questions, we'll take a motion to, I'm sorry, please.
So moved.
Oh, thank you. Is a motion to publish the proposed rules, amendments to Chapter 703 in the Texas Register in accordance with the, you know what I'm saying, Administrative Procedure Act. All in favor?
Aye.
Any opposed? Motion carries. Thank you. So now we're on to 22. And this is subcommittee business, and let's start with Ms. Mitchell on an update from the Board Governance Subcommittee's recommendations.
The Board Governance Subcommittee met on February the 5th and discussed the proposed charter for the Contract Issues Subcommittee. The Board Governance Committee, Subcommittee recommends approval of the charter. If you have any questions, the memos, tab 19.
Thank you. So let's do it again. Tab 19 is the charter for the contract issues subcommittees. Is there a motion to approve the contract issues subcommittee? Is there any discussion? If not, can we have a motion to approve the contract issues subcommittee?
So moved.
Is there a second?
Second.
All in favor, say aye.
Aye.
Any opposed? Motion carries. Thank you. And again, that's the charter for the contract issues subcommittee. There's also a memo from the audit subcommittee, including your packet, and the audit committee recommends accepting CPRIT's independent auditors, McConnell Jones.
Already accepted it.
We already accepted it. Is there an item here I need to get a motion on?
No, you're just reporting the acceptance.
We're reporting the acceptance, okay. Am I on to item 23?
No.
Wait, I'm sorry. We have a waiver.
Right.
Apologies. Third item to be discussed, the approval of an outside employment and conflict of interest disclosure waiver. Mr. Roberts will present the request for the conflict of interest waiver. Sorry.
No, I will.
I can help.
What tab is it under?
I'm sorry.
It's under tab 19.
It would help if I was looking at the right document.
Tab 19.
Yeah, I'm sorry. All right. CPRIT recently hired Donald Brandy to serve as the agency purchaser. Mr. Brandy is responsible for planning, organizing, coordinating, and preparing bid specifications and procurement documents to acquire goods and services from vendors and outside contractors used for the agency. The agency purchaser role requires little, if any, involvement with our grant award process because our grant awards contracts are not considered vendor or outside service contracts. Mr. Brandy requested approval to continue his outside employment as a referee for tennis tournaments held in and around Austin. In addition to refereeing for adult and junior level tournaments, he occasionally serves as a ref for NCAA tennis matches, which could and does include the University of Texas at Austin. Mr. Brandy is paid for his services as an independent contractor by the University Athletic Department when he referees. CPRIT employees are allowed to engage in outside employment as long as the employment does not detract from the employee's ability to reasonably fulfill his or her responsibilities to the agencies. Employees must get written approval from me to engage in outside employment, and I am required to notify to the audit committee regarding any approvals to annually report all approved outside employment. I did so notify the audit subcommittee regarding Mr. Brandy's outside employment, and it was discussed on December 18th. In order to approve a conflict of interest waiver, the Oversight Committee must find there are exceptional circumstances justifying the conflicted individual's participation in the review process or other expenditure of our agency funds. This conflict of interest waiver is different from others I've requested in that it is not seeking a waiver for actions related to our grant review or grant monitoring process. However, during the course of his official duties, there may be circumstances requiring Mr. Brandy to procure goods or services on our behalf from a university that has also employed him as a tennis referee. This is unlikely to occur. To date, we have only one services contract with an academic school, Texas Tech University. However, as CPRIT's lead contact for agency purchases, he should be allowed to perform his official duties to the fullest extent possible. In granting this waiver, I recommend that he be permitted to perform all duties assigned as purchaser, subject to the limitations that I'm about to specify. Provide the Chief Operating Officer a list of universities that have used his services as a referee during the past 12 months, notifying the Chief Operating Officer prior to taking any action on a contract or other procurement document that would result in payment of agency funds to a university on the list referenced above, and the Chief Operating Officer, in conjunction with me, the Chief Compliance Officer and the General Counsel, can review the circumstances and determine whether Mr. Brandy should be recused from involvement in the procurement. It is important to note that you may amend, revoke, or review this waiver at any time, and that this waiver is limited to the conflict of interest specified in this request. I recommend approval.
Thank you. Any comments or questions? Can we get a motion to approve the conflict of interest waiver for Donald Brandy?
So moved.
Is there a second? All in favor say aye.
Aye.
Any opposed? Motion carries. Thank you.
Thank you, members.
Thank you. Members, the Diversity Subcommittee has met, and Dr. Mulrow has communicated that you may read the notes, and there's nothing else to add from that. Don't believe we need to go into closed session. Any issues need to go to closed session? Thank you. So tab 20 shows future meetings for 15 and 16. The next meeting of this Oversight Committee is May 20, 2015. I believe we're ready for a motion to adjourn. Is there a second?
Second.
Thank you. I'm sure you're all in favor of that. Thank you all very much.